council meeting. The proceedings will take place live on the internet and the meeting will be recorded for future viewing. It will assist the conduct of the business if participants speak when invited, and members of the public are welcome to view the proceedings but should not make contributions at this meeting. All participants should mute their microphones and turn off their video feed when they are not speaking. Please remember to unmute your microphone and switch on your video feed when it's your turn to speak. Speak clearly and slowly into your microphone. Anyone wishing to speak should indicate using the raise your hand button on Microsoft Teams. I know that's more difficult for you, Elaine, but we'll deal with that when we get to you. And I will invite people to speak at the appropriate time. If you do not have the hand button, please type in your request to speak in the chat function. I ask for everyone's patience with the use of the technology, and I apologise in advance if we experience any unforeseen difficulties, which we shall try and resolve expediently. I shall now follow the items of business as set out in the agenda. Well, not quite. Right. Agenda item 1, apologies for absence.
Chair, although not members of the committee, we have received apologies from Councillors Sahota and Barnett.
Thank you. To report the appointment of any substitutes, that isn't appropriate. Number 3, to receive any declarations of interest under the Members' Code of Conduct. Those previously declared will carry on, obviously. And agenda item 4, to confirm and sign the minutes of the meetings held on the 3rd and the 16th of September 2020 as a correct record. Are they correct?
Aye, Chair.
Right.
Yes.
Thank you. Agenda item 5, local and national COVID-19 developments, a verbal update. Is that you, Val?
Yes, it is, Chair. That's
Thank
myself.
Thank you.
I think someone's got some just a few graphs to put up for me, please. Okay, so I'm just going to be doing a very brief overview of the current picture for Dudley. As we all know, Dudley is now on the first tier of the national framework, which is medium alert, but we're not far off actually being in a situation where we're likely to move to the next tier. So this is really just a reminder to Scrutiny that our cases are continuing to rise. Over the last week, we've seen 330 cases. But as you can see from this graph, we're actually the lowest amongst our sort of urban neighbours. There is a lag in the data, and I think we're now probably nearing the 90+ rates. But again, the data fluctuates depending on how we cut the data, because it's a 7-day piece. I think we've lost the data. Oh, thank you. But as you can see, we're the lowest amongst our regional neighbours, urban neighbours. The national average for the 7-day instance is 150, and that is actually what we're seeing in the West Midlands combined authority areas. The average is 150. All authorities across the region have a 7-day rate of over 50 per 100k. So again, it just puts us in perspective, and the pattern seems to be showing that the metropolitan and more urban areas continue to have higher case rates than our more rural, and Dudley seems to sit between those two. Can you just scroll down, please? The next graph just gives you a little bit of an indication of how our cases have risen over the last few months. I think if you go down to the next one, will probably be helpful, because that's the combined authority average. So this graph just gives you an overview of how that rate has increased. And again, you can see the red at the top is Birmingham. You can see that actually there's been peaks in some of our neighbouring areas where schools have returned to schools have reopened in September or end of August, and then there's been 2 weeks post that there's been a peak, and you can see that there's been another peak across the region towards the end of September, and that's coincided with students returning sort of mid-September, late September. But Dudley's rate seems to have been steady, and though we have been doubling on a fortnightly basis. I think, you know, that is really thanks to everyone's efforts, but also the fact that our sort of individual Dudley sort of circumstances has also enabled us to keep those figures low. And then finally, I just thought it'd be really helpful for you to see the cases across the different age groups. Again, Dudley's figures show how our actual rates have been compared to the first peak are much higher in our younger age groups. So the 18 to 39 and the 40 to 64, which has primarily been our working age population, have seen sort of the biggest increases. But the orange line at the bottom, you can see the 85 plus. Though we have a much lower cohort in that population, we can see actually, especially sort of starting from October, that actually cases in that age group are starting to increase now, and that's where the worry is. And obviously our partners across the NHS are seeing the impact of some of that within the system. And that's all for me. Obviously the report that we're going to cover gives you a bit of an overview of all the work, all the reports you're going to see, all the hard work that's gone in to try and help keep us managing our rates and also managing some of the challenges that we're facing within our vulnerable communities and settings. And thank you.
Thank you, Val. I think seeing it in print there puts it into sharp perspective of just how hard all of our partners have worked within Dudley and worked as a massive big team to keep the rates down as low as we possibly can. It's reassuring for the people in Dudley to see that, so I hope we publish that at some point. I see the guest waiting to join. If someone can look at that, please. Moving on to the next agenda item 6, then, scrutiny review. The council and partners' response to COVID-19 pandemic to consider contributions from key council services and areas and external partners. We'll do the council ones first. And can I remind people or request people, if they can, to keep their presentation short and sharp and to the point, and that'll leave us much more time for questions or queries on the reports. So the first one is the council response, adult safeguarding and deprivation of liberty safeguards, the Dolls report, pages 1 to 4. Matt, are you doing?
So I will introduce this very briefly to the committee. This document sets out how we responded to the changing demands for safeguarding of adults in the borough throughout the COVID-19 period and indeed on an ongoing basis. I have alongside Professor Paul Kingston from the University of Chester, who's also our independent safeguarding chair. Paul is going to talk to you in a minute about the governance arrangements and the partnership arrangements we've put in place through the pandemic. In terms of the report itself, I'm pleased to report to committee that we have continued to operate a full safeguarding service within the council and indeed across partnerships throughout. And further, as you'll see on the deprivation of liberty safeguards, that we've actually managed to significantly reduce our waiting list during that period of time. And we are now, in fact, we have the lowest number of deprivation of liberty safeguards anywhere in the West Midlands, which stands today at 26. That data has been subject to weekly scrutiny. I don't really want to add too much to the report beyond that, other than to hand over to Professor Kingston at this point, Chair.
Thank you, Matt. Professor Kingston.
Thank you, Matt. Thank you, Chair. As you can see from the report, I can report as the independent chair that work over the COVID period has been exemplary in Dudley. I say that because up until this period of time, I did chair NHS England's National Safeguarding Steering Group, so I hear what's going on around the country. In Dudley, we continue to keep safeguarding running actually on a weekly basis. We've met every Thursday morning, 8:30 to 9:30 every week since the lockdown. And in fact, today is the only day we've not met, and that's purely and simply because we have Ofsted on the premises. and we felt it more appropriate to put our energies into the Ofsted visit. We've kept everything running as best we can. It's always difficult to manage safeguarding when individuals are invisible, as you can imagine, but we've done a pretty good job given the challenges that staff have faced. I think the DOLS number down at 26, it is the best in the West Midlands. I surmise it may well be the best in the country. I don't know any authorities that have would be grateful for anything short of 100, let alone down to 26. So Stephen Lonsdale should be given a great deal of praise for that fantastic work. We kept our Care Act easements down. Some areas didn't, even in the West Midlands. They did use the easements even up to level 4. We didn't, we stayed down at 2. And we're starting to move back to some degree of a normality. I don't think anything will go back to normal, to be honest, in this present climate, but it's beginning to stabilise, although of course now we're finding that we're going through this second phase, and again we'll have to go to virtual consultation where we need to, where there's safeguarding issues. I think that's pretty much everything from me. I can report that safeguarding has functioned extremely efficiently during this very stressful period.
Thank you, Professor Paul. Does anyone wish to ask any questions of Professor Kingston?
Councillor Baton.
Yes, thanks, Cathy Baton.
Thanks, Chair. Yeah, just a quick question to Professor Kingston. I was just picking up in the report about the rise in domestic violence in the general population. Now, you know, I appreciate that Dudley's numbers are not huge, but I think it represents a 42% increase. Is that something that you've seen, in your opinion, across the country? And how are we going to manage that increase and that rise going forward?
Indeed, it is an issue across the country. One of the strange issues, though, we've had to deal with, and you might get better insight from the police perspective as well from Kim, but the police have seen a huge increase in the number of cases they've been called to. We've seen slightly less of an increase, but that's because we don't necessarily, as a local authority, see all cases that are reported to the police, but nationally the cases are up. One of the issues that is related to this, you may well have seen in the press, that alcohol sales have gone up by nearly 30% over the last 6 months. So alcohol is a significant factor here. But also the point I made earlier about the invisibility, where you've got relationships that are already fractured and difficult, and people are spending more time together 24/7. It's no surprise really that some of this boils over into domestic violence. The answer, nobody has a quick answer for this one. We certainly need to increase our services for domestic violence. I'm told in the West Midlands that we've got capacity for women who do need refuge support. I don't think we're short in terms of that type of accommodation, but any support from the third sector that could support services for people who are victims of violence, it would be extremely helpful.
Stephen, did you want to come in?
If that's all right, Chair.
Yes.
Councillor Burton, just in further response to your question, the fact that we're not seeing an increase in safeguarding concerns comes from the point that the people who are being reported to the police do not appear to have health and social care needs, and that's why there's a difference in the data. However, what we have done, and what Professor Kingston and Matt can verify, is that we've raised it with the police, and we've actually asked our police colleagues to think about making safeguarding referrals for people who they believe may have health and social care needs, and in that way we'll try and monitor it very closely. So we are aware of it, and we are putting strategies in place in order to manage it effectively. I hope that answers your question.
Cathy, did you want to come back on that?
Just to thank them both for that information and that reassurance. I did want to pick up a question around the actual DOLS report, but shall I do that later, Chair?
You can do it now, please, if you wouldn't mind, Kathy.
Yeah, okay. So the earlier statements of people that some absolutely fantastic work has been done in terms of the DOLS work and the pressures that you've all been under. But what will be the strategy going forward to maintain that outstanding performance, given the pressures on service?
Do you want me to answer that, Stephen or Matt? Or
Yeah, I'll pick that one up initially, if I may.
Thank you, Matt.
Thanks, Councillor Baton. I'm sure Stephen will add to this as well. So we have, throughout the pandemic, we have put additional staff in to manage the additional pressures and the changing patterns that have come through. And we saw it as an opportunity to get that list down as fast as we could. We will have a challenge next year in maintaining the same level of infrastructure that we've got now. However, one of the opportunities in bringing adult social care back to the council, now the Section 75 partnership agreement has ceased, is that we'll have increased mental health expertise available to Stephen and his team, and we plan to use that to increase the number of staff who are best interest, assessor qualified and have experience in DOLS. Whether that is sufficient to meet needs, and whether it's sufficient to meet needs in the build up to the liberty protection safeguards next year, is something we'll have to monitor very carefully and account for to this committee and to the safeguarding board. So I can't give you as simple an answer as it's all sorted, don't worry about it. We do have an idea where some capacity will be coming in, but I think this is one that the committee would be right to monitor going forwards. And I can certainly assure you that the independent safeguarding chair will be all over it like a rash as well.
Thank you, Matt. Kim, did I see your hand up from the police?
Yeah, it was just briefly up, just to confirm we have seen that rise and just share the numbers if you want to. So, across the borough, there's been a 25% increase in domestic abuse this year, so from the 1st of April, and that's around about 500 cases. So, you know, it is a concern, but it's a good thing in some respects because it is a hidden crime anyway. And if people are reaching out to us, and that, I know there's been quite a lot of partnership messaging around domestic abuse and the services that are available. If people are reaching out, then we can get them the support and the safeguarding interventions that they need. So I just wanted to share that data if it was of interest.
Thank you very much. Did the officers want to? Stephen.
Thank you, Chair. Just to further respond to Councillor Baton's point, if I can give you some assurance, Councillor Baton, the fact is I think we need to take the positives from what we've learned out of COVID. And what we've done in Dudley is we've taken a proactive position of actually going to our providers and asking in the residential homes, are people still subject to the same level of observation? Do they still have the same presentation? Or actually, if things improved or declined, if they've improved, we're in a position where actually we can take deprivation of liberties off and we can do extended care planning, which is following the least restrictive principle of the law. And also we can then undertake a virtual assessment or an equivalent assessment if things have remained the same. And in that way, what it doesn't do is put people under greater restrictions, because at any point during that period of detention, people can make an application to have it removed. So although we might be doing it at 10 months, doesn't mean to say that people cannot challenge that decision. And we're working really well with advocacy services to make sure we're listening to the voice of the people, and we're making sure that they are safe and they've got their needs heard in a very clear way. So I think if for me, we should not stop doing what we've done. It's been really effective. There's no reason to stop it. If COVID goes away tomorrow, we should still remain with this position, because it's put us in a position, as Professor Kingston said, we're the lowest in the West Midlands, and I'm very proud of that, as I'm sure my colleagues are as well.
Thank you, Stephen. Are there any other members who wish to ask any more questions on this agenda?
Chair, we have Councillor Cowell has raised a hand.
Councillor Jackie Cowell, thank you.
Yeah, thanks, Chair. Just a couple of points. The first one I think is probably a general point, probably to Matt. I just wondered whether we were still in a situation where staff were working from home where possible, with access to the office if necessary. You know, whether that was ongoing now and probably for the future. And the other comment, which is probably best directed at Stephen or Professor Kingston, was around paragraph 16, where it refers to the number of safeguarding concerns increasing, but the number actually progressing falling. And I just wanted to check whether they were falling because they weren't being progressed because of issues around COVID and resource implications, or whether they're not progressing because they actually don't need to progress, if you like. Just clarification on those points, please.
Thank you, Councillor Cowell. You always read the reports very thoroughly, and you certainly haven't missed anything there. So just to answer your first question before I hand over to Stephen about the conversion rates, what we've done in adult social care, our workforce falls into 3 categories, and they correspond with traffic lights. So our red rated workforce are those folk who have been working throughout the pandemic, often in a frontline capacity, and effectively COVID-19, other than PPE and social distancing, has made no difference whatsoever to them being on site and present. And that would certainly apply to a significant number of the safeguarding team. Our amber colleagues, and all of these are subject to risk assessment by team and by function, have the ability to access office accommodation as and when they need to, and will work on the basis of in-person and virtual. And those who are rated in the green category continue to work from home on the basis their role doesn't require them to be physically present, and therefore they are not currently in the office. The number of folk in the amber capacity has increased, and the number of folk in the red capacity has been a constant throughout. We have to maintain a careful balance. There are certain functions that we perform in adult social care that have to be done in person. Mental Health Act assessments being an obvious case in point. Where we've got a statutory duty to do that, and where virtual is not a viable option, we have done. And obviously we've applied common sense to people who don't sit in that category. All of those categories are subject to regular review. All of our heads of service are in regular discussion with the workforce. And the other things that we're mindful of is that, you know, for those people who are in the green category at home, people do miss their colleagues, they do miss the ability to come together and meet, they do miss the social experience of work. So we've also looked at wellbeing support for those employees who at the moment are not able to come in and on site. So all in all, I think we are very well equipped should we need to revisit this quickly in the event that second spike and further lockdown controls kick in. I'll hand over to Stephen to ask you a question about the amount of cases that are converted onto inquiry.
Thank you, Matt. Thank you, Councillor Cowell. So colleagues, if I just took you to the report and we look at the 17.2% increases in cases, that's really very interesting, because at the start of COVID-19, what we saw is a dramatic decrease in the amount of safeguarding referrals came through. And actually that was a position that was replicated across the region. Everyone was reporting a lack of safeguarding concerns coming through. However, from May, concerns started to rise. And if I was to report the figures from today, we'd be looking at approximately 32% increase, not a 17.2% increase. And that's been as lockdown ended and things have not returned to a normal state. The amount of referrals that are coming through has dramatically increased. In order to furnish that, we put additional staff in through the COVID-19 monies. And in terms of the conversion rate, actually the position is an excellent one. it shows that our threshold tool is working. It shows that our criteria is working, and it shows that we've got consistency across decision making. I can report today, at that time it was 14% conversion rate. Today it's 15.3%. So we've got an increase of 32% in referrals, but our conversion rate is 15.2. And the lower that number, the better, really. It means that our threshold decisions are right. However, what it also means, you could look at it two ways. You could look at it as there's a number of inappropriate referrals that shouldn't be referred, but I don't think there's any inappropriate referrals, if I'm quite honest. I think that everyone who's got a concern should bring them through. But what it does mean is that our threshold tool is working as it should, so it gives us assurance, and that's my position.
Thank you. Jackie, did you want a supplementary question?
No, thanks, Chair. Just to thank Stephen and Matt for their answers, very comprehensive answers. Thank you very much for that.
Thank you.
Okay.
Thanks.
I see no more hands up. So can I just thank Professor Kingston and Stephen and Matt and all of the team for the work they're doing. It's clear from the reports that if you look at them as a layman, we're in good hands, and that's a great comfort to anybody who needs support, especially on MASH. So thank you very much for all your work on that, and I know you'll continue to support those people in need, and I can see us being used. I'd like to think we'd be used as an example of good work in practice. So then we'll try and flag that up for you. Thank you very much.
Thank you, Chair.
Thank you, Chair.
Agenda item now. The Children's Services paper has been pulled from this meeting for no sinister reason other than the fact it's Ofsted have descended on Dudley, and that's critical that they all be present to deal with the Ofsted issues. So I'm going to call in Phil Parker now to bring the COVID communications update. Can you do your presentation, please, Phil?
I can. Thank you, Chair.
Items F, but it's now B. Thank you.
Thanks, Chair, and afternoon all. I'm sure members will recall that I presented a full and a comprehensive report at the last committee meeting, and I am mindful of the number of full reports that you've got today, so I do promise to keep this brief. However, as requested through the Chair, we felt it was important to provide Scrutiny Committee with an update on communications activity since the committee's first COVID-focused meeting back on September the 3rd. So, as Bal has already outlined in the opening today, since September the 3rd and through September and obviously on into October, we have of course seen significant increases in the virus nationally and locally. And as you'll appreciate, on the back of that, this has prompted a huge amount of continued communications activity from the council. We've continued to use a multi-channel approach, as outlined to you in the previous meeting, to target different audiences across the borough, as we look to ensure that communities are well informed and in a position to comply with the changes to restrictions, and ultimately, of course, to help look after themselves, look after their businesses, and look after their loved ones. I've prepared a visual aid for members, which I'll just scroll through slowly. As I say, I will not take up too much time, but hopefully the visual aid will just at least put things in front of you so you can see what we've been up to and what the latest position is. This covers a period right the way through from September the 3rd through to the very start of this week on Monday. So it's pretty up to speed with where we're at in terms of comms, activity and reach. In terms of media, obviously media relations continue to play a significant role, and our local and regional media colleagues have been a key channel in continuing to share news and vital public information with our communities. As you can see, in that time, in the last 5 weeks or so, 27 media releases have been issued, specifically around COVID activity, and generally, broadly speaking, a positive or at least neutral tone to coverage within the media, which is good. And in addition to the editorial side of things, we've also got paid for advertising with colleagues at the Express and Star and also the Dudley and Starbridge News. In terms of other channels, e-bulletins, which we touched on last time as well, become a really significant communications channel for us to get out digitally to large numbers across the borough. Pleased to say our open rates on these emails are still high and higher than the national average. I think the national average is 25%, and as you can see there, the COVID app, for example, when that was launched and our bulletins went out on that, 58% far exceeds the average of people linking through to pick up the information, hopefully ultimately download the app in that case. In terms of social media, obviously Twitter and Facebook are the primary channels through social media, and I'd point members really to the number of impressions on Facebook. There are 1.5 million impressions. Impressions are essentially opportunities for people to see the posts that we put out there, thanks to other people sharing them and liking them. That's the level of reach that Facebook's had just in that 5-week period, and Twitter in a similar way, 500,000 again there. So really significant reach of getting those messages out, such as showcased there, the wearing a face mask visual. That's one of our Facebook campaign posts. In terms of the website, the coronavirus webpage has continued to be a really useful tool and a useful channel for members of the public to go to get their latest information. As you can see, 23,000 pretty much page views in that period of time, specifically on the coronavirus page, and another 34,000 across the news pages, which have obviously been populated with a lot of those media releases that I mentioned earlier on COVID-based activity. In September alone, in the month of September, I know we had a 34% increase in terms of page views compared to August on the coronavirus page. Ordinarily, I would have put this down to August being quiet because of a holiday period, but I don't think many of us had the opportunity to go away this year, so I don't think that necessarily applies. I think September's seen a spike more down to the return of schools and changes to restrictions where people have been keen to pick up information and keep themselves informed of latest developments. Campaigns and features. Primarily, our campaigns and features have, in the last 5 weeks have been around the amplification of government messaging. So it's about us localising it, play your part, protect Dudley Borough, being our local strapline to all of those government messages that we're all familiar with that I'll very briefly outline. We can see here nearly 10,000 views on a video that we produced in-house with a cross-section of society, included on there, leader of the council, Bal, our Director of Public Health, right the way through to local school teacher, parents, GP, business owner, the bishop, an imam, and a shielded person. So a real variety there of people speaking in video, which had 10,000 views, which is a real success. As well as the digital side of things, it's much harder to illustrate in terms of numbers and analytics, but obviously the traditional posters and leaflets and so on have continued to go out around these key items, leaflets delivered to thousands of homes again and in translated forms for community languages where appropriate. Just moving on, as I say, hands, face and space, obviously one of the key government messages, so we've been pushing that out as hard as we can around those hygiene messages and wearing your mask and obviously social distancing. You can see again the figures there. In terms of visuals, specifically targeted on the right hand side there at younger people, and this hands, face, space message has also been part of our shop local campaign, where we've been encouraging people to obviously shop locally when they return to the shops, but to do it safely. So it's included the hands, face, space message as well on there. This visual here was also part of a Snapchat video campaign directly at young people. And as I say, it's gone through our schools and colleges as something to hopefully encourage the younger generations to follow the guidelines. I've already referenced the app, Chair, so I won't dwell on that one. As you can see, it's got those significant open rates on the bulletin, both business bulletin and residents, encouraging both business and residents to download the app. Unfortunately, I don't have figures to show how many people across Dudley Borough have downloaded the app. I'm making inquiries as to whether we can actually establish that as we speak. And Bal mentioned about the return to school, obviously at the start of September, a significant moment, and as you'd expect, dedicated communications to parents have gone out, as well as directly to our borough schools in terms of supporting them on that safe return of children to our schools, using the government visuals and messaging. And the rule of 6, similarly to the hands, face, space, again, pushing those messages out as you would expect. And the final one, Chair, which I think you specifically asked for when we discussed this in the pre-meeting, was around the COVID. So the Members Toolkit, this is more into the engagement side of things rather than directly just comms, but this was issued to all members on September the 14th. It's been developed in partnership with members who are sitting on the COVID Outbreak Engagement Board, and it aims to give members an increased understanding of the emergency response framework, which was the report that Barry Jones presented at the September the 3rd meeting. Also an easy to use guide of useful links and information, which we are constantly updating. There's tips there on community engagement and also the use of social media for members. And within that, the amplification campaign toolkit. So you've actually got the assets there. If elected members want to post onto their own social channels, original artwork and so on, they can do that with the stuff that's within the toolkit. I think the toolkit's been presented in recent weeks at a couple of different members' COVID-19 webinars. And as I say, it's a live document, so we are continually refreshing with up-to-date information. I think version 2 will be live this week, so I assume by tomorrow, and shared with members again, and it'll be hosted on the members portal. Chair, that was the summary of the last 5 or 6 weeks. Happy to take any questions. Equally happy to share these documents. I appreciate I've had to scroll through it at pace, mindful of the time. Thank you.
Okay, thank you, Phil. Do any members wish to ask Phil any questions about communications? I've got one somewhere. Kathy Baton.
Thanks, Chair. Phil, I just wanted to sort of ask you really about the changing in messaging and how you, because obviously this week we've had a change in the tiering system. So how you make sure that the way you're putting the messages out to people about where Dudley sits, about what the risks are to people, about helping people to really understand the message about the current rating, about what the restrictions are for people versus what the restrictions might be in neighbouring boroughs. Because I think there has been some confusion around where we've got neighbouring boroughs who are in quite different restrictions and have to do quite different things. So how easy is that from a comms perspective to keep that message simple but up to date and clear for people to understand?
Thanks, Councillor. Yeah, I mean, to answer it bluntly, I think it is a significant challenge. A lot of our media, for example, Express and Star, Free Radio, they're covering obviously the broader regions. So when everybody else is in a different tier, the message that a lot of our residents are picking up and hearing will be around tier restrictions. We've got to obviously localise that to make it apply for Dudley. At the same time, the leader of the council this week was very clear in terms of his position that whilst we need to be grateful and thankful to borough residents for complying and for us being in this relatively strong position, at the same time as Bal outlined, and I think the leader has made clear as well, actually within our messaging this week, we could be a week away from moving into a different tier and increased restrictions. So yeah, it is a huge challenge. It's very difficult to keep it simple. Obviously the government messaging, when it changes, we're having to respond to that, and we're having to respond at the moment on that tier 1. Equally, whilst that's good news, what it's not time for anybody to do is become complacent across Dudley Borough that we're in tier 1 and everything's okay, because as we've made clear this week in the comms, and I think that's on the front page of this week's weekly papers, as well as covered across BBC WM, Black Country Radio and Free Radio, is that message that we can't be complacent, and we could be 7 days away from changing into a different tier. So yeah, huge challenge, doing everything that we can. If anybody's got any suggestions in terms of how we can do it even better, please do feel free to chip in as well, but thank you.
Okay, Kathy, is that okay?
Thanks, Chair.
Thank you. Any other members wish to ask Phil any more questions about comms? I see none. Do any of our external partners wish to ask Phil any questions about communications? I am aware that we've got a massive communications network which may not be replicated in one or two of our partners. So I'm sure we can help out. I'm not offering, Phil, I'm not offering for you to do everyone's comms, so don't panic. But if there's any support, Val, you wanted to ask a question.
No, it wasn't a question. It was just to say that we have got a communication cell that has been set up as part of our response, and it is made of partner representatives, comms leads, and we do work very closely with partners. And I know where we've identified gaps, for example, the voluntary community sector, they've also had a seat round the table. So we are working. A lot of our comms is also influenced by the comms of partners and their insights as well.
That's good news, Val. Thank you very much. Right. So we accept that then. Thank you very much.
Thank you, Chair. Thanks all.
Thank you, Phil. I'm not going to read through all the recommendations. I'll take it the recommendations as they are. It'll save us half an hour reading the recommendations. The recommendations as printed will be accepted by the committee.
Sorry, Chair, I think you've got a hand up.
Liz Avis.
Yeah.
Liz.
Hi, Chair, sorry. It was just to reiterate what Val and Phil have both said. We have a fantastic network of comms leads across Dudley Borough, and I've certainly been personally very thankful to some of the council colleagues who have helped support all of the campaigns. I think it's out of a really negative situation. It's really joined us all up brilliantly. So I would just support what's been said.
Thank you, Liz. Wait till you get the invoice.
Thanks, Liz.
Right, moving on then to agenda item C, which is public realm. Gary Dean, is that yours?
Thank you, Chair. That's certainly mine. Yes. Right. If I just give you a bit of a general overview regarding the impact of COVID-19 on frontline services, in particular within the council's public realm division. As a division, we do deliver a very diverse range of frontline services. It's detailed down within the report. And during the lockdown period, there was obviously a requirement to maintain and continue many of those services. I think it's important that we look at the journey that we've actually followed, because clearly throughout that period, we've had to adhere very closely to government guidance, which has resulted in some changes in our services. And certainly the position that we're in now is significantly different compared to what it was at the commencement of the lockdown period. But as a frontline service, clearly we have a responsibility to provide a number of key essential services for the local authority, and a number of our services have to be available 24/7. To deliver and attend to a whole series of issues such as RTAs on the highway, such as winter gritting, that obviously we'll be moving towards in a very short period of time. So an element of statutory provision within those services as well. Item 5 gives a bit of detail just with regards to the impact on the individual service areas as a result of COVID-19, and some of the key things that we have actually accommodated is our housing maintenance team. Whilst we initially suspended some of the work during the early part of the lockdown period, we still had a statutory responsibility to undertake gas inspections and also electrical inspections on the borough's housing stock. We've since resumed a full service from 15th of June on the housing maintenance, which is undertaking a lot of the general repairs and maintenance on council housing staff. I've touched base earlier that a number of our street maintenance and highways teams do have to provide a 24/7 basis. Throughout the period, we initially looked at different staggered starts. We had a number of staff that were working shifts just to ensure that we were targeting all the key elements of the service. At the moment, we've resumed to a full service at the moment, but clearly we still have some of those teams that are starting at different times of the day. We've staggered lunch breaks. We've had to look very closely at how people are transported to and from sites. But again, a lot of work very closely with our trade union representatives associated with that. We do have a number of statutory services that we deliver, and an interesting point is particularly with regards to refuse and recycling over the period. We actually noticed a 15% increase in levels of recycling and further 10% increase in the amount of refuse that we collected, particularly during the initial lockdown period, which obviously confirms that a lot of people at home were generating lots of additional waste over the period. The Lister Road emergency or energy waste to energy plants obviously continued throughout the period itself. And in addition to that, a number of other statutory services such as our licensing and our waste enforcement teams have worked very, very closely with trading standards, and also the police, ensuring local businesses are adhering requirements laid down by government. And members of the committee will be aware that certainly the latest 10 o'clock lockdown of licensed premises, a number of those teams have been supporting the police again and trading standards, visiting those premises after 10 o'clock of an evening just to ensure that they're adhering to the requirements. Where that's not the case, they're obviously taking appropriate enforcement action. During the period, we have a responsibility to maintain the highway in good order, and that's not only the work that we undertake on the highway, that's also utility companies and private contractors undertaking work out there. And we did notice a 25% reduction in the amount of street works that were actually taking place on the highway. A lot of that was based on the advice from government on construction companies regarding what they could and what they couldn't do throughout the period. However, the levels are getting very close now to what they were prior to the COVID and the introduction of the initial lockdown period. Green care is a particularly important one because whilst we look to close a number of our play areas down, we did actually report up to a 50% increase in footfall on a number of our parks and open spaces across the borough. That itself provided a number of challenges with litter and emptying of litter bins throughout that period. That in itself as well also did result in some antisocial behaviour on a number of our sites, particularly around some of our nature reserves with quad bikes and small elements of antisocial behaviour. We also experienced an increase in the number of incidents of fly tip that we experienced over the period. Certainly a challenge for our street cleansing team moving forward. And some of our traffic and transportation teams work very closely on a number of the physical measures that we introduced in towns to ensure adequate social distancing from visitors to those centres. Item 7 of the report, Chair, details down some of the services that we temporarily suspended over the period, such as public conveniences, very much based on government advice, that are now open again. Members will be aware that we suspended initially green waste collections for a period of a month, which covered 2 collections. That was primarily to ensure that we got sufficient resources in our frontline refuse collection teams. But after the month period, we resumed again collections on the 27th of April, and we're extending the collection period a little bit later in the year to accommodate for that loss during the earlier part of the year. In addition to that, based on government advice, we introduced a booking system within our housing waste and recycling centre that's continuing to operate at the moment. You will have to. I will have to apologise, Chair. Unfortunately, I've got 1 or 2 phone calls. I think people are trying to contact me for whatever reason, so I do apologise on that. In addition, we temporarily suspended MOTs at our narrowboat way, again based on government legislation moving forward. We equally eased off on the number of inspections, which is a voluntary inspections that we do on our vehicles, just to ensure that all of our mechanics were targeting our fleet vehicles to ensure that they remained on the road during the period. Obviously, there's a financial impact, particularly with the elements of traded services that we deliver. That's detailed down within the item 9 and item 10 And we are looking very closely at government grants with regards to recovering some of that shortfall that we're continuing to work through. I think it's also important, particularly on item 13, where in some of the services that we did suspend, what we very successfully did was to look to redeploy those services or those staff to other areas of our service. So an example, a number of civil enforcement officers that we reduced provision during the lockdown period, we redeployed those to support marshalling duties at the Housing Waste and Recycling Centre. In addition to that, a number of our street maintenance staff equally supported some works at the Merry Hill Centre through the testing procedures that were actually introduced. And a number of our green care staff were temporarily deployed onto grave digging duties to support some of the work there as well. We equally played a fairly active role to support a number of the food deliveries at Saltwells, where again we were actively involved in putting some of that food together, organising that arrangement, and equally delivering some of that food to those that were shielding or self-isolating across the board. I think in summary, clearly COVID has had an impact on our services. However, as with adult services, we've very much operated the red, amber and green rating. A number of our frontline services fall within the category red rating, so continue to operate and have continued to operate throughout the period. We have a number of amber rated staff that report directly to site and occasionally visit the office to either pick a paper or instructions. And then where possible, particularly some of our professional and our back office support staff, we have those working from home. We're operating very differently compared to what we did pre-COVID, but certainly the measures that we've put in place, I believe, and I'm confident, have worked and continue to work moving forward. So with that, Chair, I'd like committee obviously to note the comments of the report and the actions taken by frontline services during the COVID period. Thank you.
Thank you, Gary. Councillor Elaine Taylor, you've got your hand up.
Thank you, Dave. Yes, I have indeed. This is the first chance, because I'm parked up now, for me to actually get involved. Gary, thank you to your team. You've done a brilliant job throughout the period, especially with the enormous fly tipping that we've had. Can you tell me, has it now gone, because I didn't quite catch, has it now gone pre-COVID? And the tip is by appointment only. Is it still being booked out solidly, or has that evened out as well? And follow up, hang on, can I just ask this before I lose you because of the signal? We've employed some temporary EHOs. Are they? They're doing random visits, as I've heard you say, and reporting incidents. Are in the general businesses complying with the new legislations, or are we having, issues? Is that the right word? Yeah. Yeah.
Right. If I can, if I can pick them up from the last one, where clearly where we've taken on board additional environmental health officers, they are working, as I mentioned earlier, very closely with the police, our trading standards, and also our licensing team at the moment, just to target individual businesses to ensure that they've got adequate social distancing arrangements in place, and they're adhering also to their licensing requirements. I think it is encouraging that certainly of the inspections that have taken place, and I'll give an example of last weekend where 15 premises were actually inspected. Of those premises, 14 were adhering to all of the requirements. Unfortunately, one premise wasn't. However, they've strongly been advised that enforcement action is being taken against them. So we will, I think, as a council, work very, very closely with the local businesses to support them where we can. And I know certainly we've worked very, very closely with Phil Parker's team with regards to the information that's been sent out to local businesses, the advice, the guidance, and any support that we can provide them. But unfortunately, there will be the occasional one in the borough that pushes it a little bit closely. Obviously, we will speak to those. If we believe that there's a blatant breach, then yes, we will take action as a local authority. But invariably, the feedback that I get, Councillor, is that the large majority of people are adhering to the requirements. With regards to the tip, you'll be aware that when we introduced the booking system, there was quite a large-scale interest, I think is probably the right word to say initially at the start. I think that's on the basis that you'll be aware that we didn't actually close the tip for a number of weeks based on government advice. It was very busy during the initial period. That's levelled out now, and there are a number of vacant spots where people can go online to book a place. That's working relatively well at the moment, and I'm getting a lot of positive feedback. Currently, as it stands, there's no intention to change that. So we're continuing with a bookable service at the site. And then with regards to elements of fly tipping, we're continuing to monitor that. The levels are coming down, but they're still higher than the levels pre-COVID-19. And I think that's on the basis that there are still a number of people, obviously, at home at the moment, but it's something we're continuing to monitor, not only to remove that fly tipping, but it's very important as well that we try to be as proactive as we can with regards to enforcement action. And that with regards to incidents of fly tipping, if there is any evidence, and our enforcement officers will check the evidence, that we can identify where that fly tip came from, then we will take enforcement action against those involved. Thank you.
Thank you, Gary. Val, you had your hand up. Did you want to clarify anything, or have you put it down?
Sorry, Chair. I think Gary did a really great job of answering that. It was regarding the environmental health officers, because they sit within my sort of area of work, but actually we've been working in full collaboration. But they've also, the additional capacity that was brought in was to also ensure that the team were helping us with all of the preventative work, and also to ensure that we're responding to queries as they come through. They've been a real godsend in terms of the whole team has actually been helping us with that, dealing with situations on a daily basis. But yeah, you know, and on the whole, as Gary has said, businesses have been very compliant, and we've not had the same situation as we've seen in other parts of the region.
Thank you, Val. I've now got Councillor Kathy Baton and then Councillor Jackie Cowell. Ladies, can you ask your questions one after the other, and then we'll get Gary to answer both. Thank you. Kathy first.
Okay, thanks, Chair. My question to Gary is around your preparedness as a service for the coming winter months. You've already alluded to the fact that obviously we have a duty to keep highways moving, and if we move into a particularly cold spell when we have gritting requirements and road issues, are we prepared as a council to deal with that, with the potential for much higher than normal levels of staff sickness absence? Thank you.
Jackie Cowell, please.
Thanks, Chair. I've just got a couple of issues I'd like to raise, Gary. Firstly, in relation to item 5, and it describes how we're now doing the full range of housing maintenance services in line with government guidelines. I'd just like some more clarification on what measures are in place for that, please. And also a quick one on Kingdom enforcement. I just wondered whether they were back up and running now, please. Thank you.
Thank you both. Over to you, Gary.
Okay, thank you, Chair. Right, with regards to the first question on how prepared are we for the winter period, As a frontline service, we do have a number of standby arrangements that we have to put in place with regards to delivery of our services, and those services are very much a 24/7 basis. So it could be, if we're looking over the winter months, winter gritting operations taking place in the day. It could be winter gritting operations taking place during the evening. It could be throughout the night. What we do in providing that service, the service is delivered through support from a range of our frontline services, and that's one of the benefits that we have at Lister Road Depot here. So it's not just our highways teams that actually support that service provision. We equally have street cleansing drivers. We equally have some drivers from our green care teams, from our street lighting, and also our fleet workshops. So it's very much looking at all of those resources. Plans are currently taking place at the moment to put those rotas in place. We operate a formal rota from mid-November through to mid-March. However, we can equally put arrangements in place at short notice if need be. Clearly, we'll need to continue to monitor the impact of COVID-19 on our teams, and we'll continue to do so. But we will operate in accordance with our contingency plan that was in place prior to COVID-19. Clearly, we've reviewed that as part of the impact of COVID. But again, I'm confident that the measures that we have in place will ensure that we are maintaining the highway and our services correctly and in accordance with our statutory requirements. The second item, if I can just pick up on the first one, which is Kingdom Enforcement, and I would confirm that Kingdom Enforcement are working within the borough at the moment, so they are in place, they are around. With regards to item 5, just on housing maintenance. The housing maintenance teams undertake a wide variety of works on council housing stock. Some of that work is statutory, such as gas and electrical inspections. There's equally a whole range of other works that we undertake through maintenance works, which can include plastering, it can include carpentry works, it can include roofing works, bricklaying works. So it's a full element of trade that the housing maintenance teams do. We're providing that full service at the moment, but clearly throughout the period we've worked very, very closely with those individual teams, just with regards to measures that need to be put in place regarding staff visiting premises, and a number of those visits are bookable in advance. So it's very much about a series of questions that the teams ask regarding does the tenant show any signs of COVID or measures that the staff have to follow in accordance with their own risk assessments. I know, Councillor Cowell, that you did actually raise this at full council the other day, and I know that Laura Taylor was going to provide you with some comprehensive information just with regards to the processes and the procedures that's in place with those frontline teams. So hopefully that will be quite supportive to you moving forward.
Thank you. Any other members of the committee wish to ask any more questions?
Chair, Councillor Baton has
You've still got your hand up. Yeah, Kathy.
No, sorry, I hadn't put it down.
Okay. Well, thank you. So we'll accept that recommendation as per the document there, and I've been told during your presentation, Gary, that you are now recovering from COVID.
I'm fully recovered now, thank you, thank you, Chair. It's a good job we've got adequate contingency arrangements in place in my absence.
Well, it says a lot that you've had it and you're back at work so soon, and you've taken the time to come and give us your report. So thanks very much for that. Can you thank
welcome.
all of your staff in your directorate, please? Thank you.
Thank you.
So, agenda item D now, housing services during COVID, pages 33 to 36. Paul Davies.
Thank you, Chair. Thanks for the invite to the committee. I suppose unsurprisingly, most demand in our service was on the softer side, the people orientated side. We're particularly relieved and pleased that we managed to prevent any outbreak of COVID in our sheltered scheme during the lockdown. A lot of proactive work there with partners and with the residents and their families and carers. We had a big increase in homelessness presentations, about 50%, due to people being thrown out of homes where they'd been normally sofa surfing or occupying a spare room because of the lockdown and people's concerns about COVID. So an increase in use of temporary accommodation. Alongside that, we did a brilliant piece of work between housing, public health, adult services and the police for people who were unwilling or unable to self-isolate when they had COVID or COVID symptoms, and worked with a charity there to provide a 24/7 hour service, which effectively kept people out of the cells who would have been there as a last resort. And then a big increase in antisocial behaviour being reported, particularly about noise, but sadly some instances of modern slavery reported, and a significant increase in domestic abuse. Our community safety team works corporately and with partners across the piece. They support the statutory Safe and Sound partnership and are also heavily involved in the domestic and sexual abuse working group and the community cohesion strategic group. So they were involved in a lot of the domestic abuse campaigns with adult and children's services as well. That was particularly effective in enabling people to come forward who needed help. So it's a very brief walkthrough, Chair. Happy to take any questions.
Thank you, Paul. Are there any members wish to ask any questions of Paul Davies Housing? Councillor Jackie Cowell.
Thanks, Chair. Yeah, just quickly, I just wondered, you referred, Paul, to the number of, I think, to the facility for people who, for the homeless people who are potentially COVID positive. But my understanding was, I think didn't we make some facilities available to the more general homeless population, some of the void properties or something. I wondered how many of those were made available, and whether there is any places still available on an ongoing basis, please.
Yeah, thank you, Councillor Cowell. Yes, we had 20 flats, partly furnished flats available for homeless, which were fully occupied. We occupied a number of B&B establishments that specialise in temporary accommodation and were able to stay open. And we had all 6 units that we have supported accommodation at the Live Family Centre, which is set up for temporary accommodation as well. They were all in use. The biggest increase was in single men, so a lot of them went into temporary accommodation rather than necessarily the Live Centre or the flats.
Thank you, Paul. Councillor Cathy Baton.
Thanks, Paul. Couple of things. So just picking up on Jackie's points and your answers about where people were housed during lockdown. Do people still remain in those accommodations now? Are they still being utilised? And as we look forward to the coming winter months, what's Dudley's position in terms of accommodation for the homeless over the winter months? And will there be any additional government funding to manage this going forward? And should we move into a higher tier restrictions, will there be the same requirement to make sure every homeless person is engaged with and off the streets for that period of time?
Yes, for you, Chair. Thank you, Councillor Baton. Yeah, we've still got a significant number of people in temporary accommodation. That was partly because refurbishing empty homes was one of the areas where we had to stop work with our housing maintenance colleagues because, one, they couldn't work, and two, the government had stopped people moving. So we had a backlog of accommodation that we've been working through and letting as rapidly as possible. So we should be able to clear the backlog there. Most people we accommodated within the borough. We only had about a third of our B&B accommodation having to be outside of Dudley, so most people were there. We do still have a significant amount of temporary accommodation. We tend to have at any one time about 20 semi-furnished units ready for people to come into. In terms of grant funding, well, we applied for absolutely everything that was going. We got over 650,000 core homeless funding, plus extra bit from the COVID pot that local government got. We'll certainly be applying for anything that comes up again. I'm not aware of anything at the moment. One thing we did apply for during COVID and has to be spent during March is move on accommodation. So we're refurbing some property that will be shared accommodation for MHCLG. With their funding, I think we've got £150,000 to be spent by the end of this year to provide effectively 4 bedsit shared accommodations as temporary housing.
Thank you, Paul.
Can I just come back, Chair, on that? Okay, so if there isn't any further funding made available nationally to us as a local authority over the winter months, are we in a position to be able to make the commitment to people in terms of homeless accommodation?
Yeah, Chair, if I can come back on that, yes, but the homelessness is a general fund service, so not out of the very large housing revenue account. So I think we may have to refurbish and provide the homes out of the HRA. There's a limit, obviously, to the amount of homelessness grant and funding that we have from central government. It does get under pressure. There is a huge demand. We've been able to manage it to date, and all bar 2 brothers who absolutely refused to engage with all of our multi-agency approach. We got everyone in off the street during the COVID lockdown. So the actual number of rough sleepers left in Dudley is down into low single figures now. So I think we'll be able to accommodate them quite safely through the winter. But you're right to highlight the resource issue. That is a continuing pressure.
Thank you, Paul. Any more questions from members to Paul Davies?
I've got, sorry, Chair, Elaine, because Elaine's dropped off the call, and I know she'd got a couple of questions for Paul around the rent arrears.
Will you take them then, please, Cathy?
Yeah, so she'd asked around the increase in rent arrears, how this is going to be managed, the impact, long-term impact on council finance. You know, we can anticipate, I think, that with some degree of certainty, the job losses within the Dudley Borough following the furlough scheme ending. So I think we can anticipate that. So how are we going to manage the rent arrears? What will be the impact on council finances? And she'd also asked if we've seen a rise in universal credit claimants.
Yeah, for you again, Chair. Yes, we had on the last point, we had an increase of 700 universal credit claimants between March and the end of May. We do have a very good working protocol. It probably is an example of best practice nationally with DWP and some of the housing assistance grant as well that we directly administer that the council get. We are predicting that 0.6 million increase to date will be up to around £1 million increase by the end of the year, so approaching a £4 million rent arrear figure. And that's partly modelling potential impact on the third of our tenant population. About 1/3 of them will be in jobs that potentially vulnerable to furlough or job losses. We obviously hope that that won't happen for our residents. So we're very good at getting them into universal credit. There is a 6-week delay, and we've obviously not enforced deliberately, and that was a policy decision as well locally, the collection of rent arrears due to COVID and during COVID, and the courts have been closed anyway. We're certainly not evicting people for that, but we are starting to encourage people to pay again and doing a lot of follow-up work, a lot of money advice. And the team that would normally be doing enforcement of rent arrears are actually proactively doing advice and helping people through the universal credit system. But there is an impact, and it, as I highlighted in the report, it could constrain resources in some areas next year, but we're still actively collecting rent from the majority of tenants. So we'll work that through. By Christmas, we'll know a bit more.
Thank you, Paul. Is that it?
Sorry, can I just come back on that? Sorry, Chair. Do you anticipate having to move towards court-based action in terms of rent arrears, or is that going to be something that, given the difficult times that people are in, will that be put on the back burner for the foreseeable future?
Yeah, it's always a dilemma, isn't it, between the the social objectives of a council and the kind of business plan, balanced finance that you've got with a ring-fenced housing revenue account, because our only source of income for the HRA is the rent. So it will constrain other services if we don't collect it. We've only got one case before the courts, and that's someone who hasn't paid rent for the last 2 years. So we are, for anyone newly into rent arrears or who may be affected by COVID lockdown, we are taking a very sympathetic case-by-case approach. But we do need to encourage people back into a payment pattern, even if it's partial payment of arrears, because otherwise, come next March, April, they could be faced with an overwhelming debt. And what we do know is debt has psychological effects and health effects, not just the income for us. So we're in regular contact with people, but the actual enforcement action has been very minimal, none until September, and only one case in September, a historic case really. But most people are finding a way to prioritise the rent. That's the key thing we've been emphasising. Out of all the discretionary spend areas they may have, the rent isn't one of those.
Thank you, Paul. Okay, Kathy.
Yes, thanks.
Thank you.
Thank you, Chair.
Thanks. So we'll accept that recommendation then, as the committees had agreed. Yeah, I'll take the silence as a yes.
Yeah.
Right, moving on to, I'm aware that we're now an hour and 20 minutes into the meeting. This is the last local authority report, and I'm aware that our external partners are in their starting blocks, ready to give their reports. So if we can try and speed things up a little bit, if possible, please. And this is the next report, agenda item 6E, the Outbreak Control Plan and Local Government's Arrangements. Bal, is this you?
It is, yes, Chair. I'll be really quick. Just to say that this report is an overview of the sort of public health and wellbeing response to the COVID-19 situation, but it also covers some of our governance arrangements we've put in place around a more formal outbreak plan that was required as part of the response from the government. And it's also built upon the previous reports that you've received at previous scrutiny meetings. So I'm not going to go into a lot of detail, and obviously you have had it in advance, so hopefully you've had a chance to read it. I'm not sure if everyone's actually aware, but the Public Health and Wellbeing Division is responsible for public health, but also emergency planning and environmental health and trading standards. As you can imagine, all three of these service areas have been crucial to the COVID response for the borough. And actually, I think it's been a real asset and strength to the local authority for having these actually sat under the same sort of leadership, because it's really meant that we've been able to really draw upon the strengths across the whole of the directorate, and it's helped us avoid duplication and ensure that we've been using our resources in an effective way. A lot of our activity when we first sort of started the response to COVID-19 was based on the 8-point plan that you received at the previous scrutiny meeting, and then what followed very quickly in June was the need to put in place our local outbreak plan. So I'm not going to go into detail, but what you can see from the report is that a lot of what we've done has been in collaboration, in partnership, both internally within the local authority, but also with partners across the system. And as a Director of Public Health, it's been my responsibility to ensure that the system has responded accordingly, and we've done everything we can to protect our most vulnerable and keep people's population's health and well-being at the forefront of this crisis. Some of this that you've got in the report, you've picked up, and it's been picked up in other aspects of the reports from different directors. So what I'll do is I'll just quickly move on to the Dudley Outbreak Plan. Again, the report demonstrates the fact that we had to put something in that was really robust. We were actually, our outbreak plan was actually reviewed by the Department of Health and Social Care. It needed to be signed off at that level. What was really promising for us was it was a very, very tight turnaround. And a week prior for it to be submitted, we shared our draft versions, and Dudley's outbreak plan was seen as an example of good practice, and therefore it was shared across the region so that other areas could use it to shape theirs prior to the final deadline. What was really advantageous for us is that the plan has given us a really robust framework to coordinate our response and prepare, in fact, in advance of us moving into any tiers. And also what it's enabled us to do is really pull together the partnerships. And again, it's helped us avoid some of the duplication. There's key sort of principles that underpin the plan. And there's also a robust governance arrangement that's been put in place. And it's through this governance arrangement that we've really been able to strengthen our communications and engagement approach. And we know from evidence across England that where there's been outbreaks and where there's actually been high rates of infection, and where areas have gone into intervention, and that where they've been able to bring their rates down, it's been purely down. A strong element has been that community engagement. So I think that that we've really been able to build upon that. So I think the other thing we've been able to do is test our plans. We've worked with partners to test our plans. The whole plan's been tested, but we're also undertaking individual tests. So Paul didn't mention, but Paul's leading on a scenario in a high-rise flat. We're going to be doing some work around enforcement and with the police. So lots of work has gone on, not only to prepare, but also to test that what we're doing is actually right, and learning from that testing. If you'd have asked me a month ago, I think some of the challenges and issues that are presented in the report would have been quite high on my list, but over the last few weeks we've really been able to move to a position where, for example, with testing, we are now at a place where our testing capacity will be increased by the end of the month, and I think partners will agree that actually the situation with testing access has now eased, that we're not getting the level of complaints or challenges that we were a few weeks back. Enforcement has become far clearer for us, and we've been able to pull together a local team to help us sort of understand what that means in terms of police's responsibility and the local authority responsibilities. Our workforce capacity is still an issue. There is a lot of work that has been pushed down to the local authority. Again, where we can, we've tried to use local resource, and we are also we've been very fortunate in the local authority to have, right from the onset, put in place a redeployment plan, and we're now going to be firming that up. So it means that where in any emergency, in fact, not just COVID, that we sort of understand what the skill set of our workforce is, and we can draw upon them. So one of the pieces of work we're doing now is that we're training up a number of local authority staff to support us with contact tracing, because as we move into the next tier, it's likely that some of that will come down to us as well. In terms of some of our biggest challenges have been it's non-adherence and non-compliance, and that's not necessarily the businesses or the settings as such. It's individuals and sort of behavioural sort of attitudes towards following guidance. What we're doing is we're hoping that actually our COVID-19 champions will support with this engagement further. And finally, data integration is a lot better now. And just to summarise, I just wanted to say that what I think, we need to sort of remember, and we often aren't very good at sort of shouting out about this, but there's a lot of our work has been shared elsewhere. So our Health Protection Cooperation Agreement has been a real firm foundation in terms of our response across the partnership. As I've said, our outbreak plan was shared as an example of good practice. Our care home training programme is also being shared across the STP area, so that other areas can deliver that training as well. Our welfare calls has also been picked up by other areas. We set them up in order to contact people that were testing positive and through the test and trace national system, but we also wanted to use it as an opportunity to get further information from those individuals, and other areas have sort of followed that. We've also set up specialist teams to deal with particular settings. So when schools came back in September or end of August, we had a specialist sort of schools team step up to support that. Again, other areas have sort of used that model now to support the education setting, and that's really helped our education colleagues, head teachers, gain confidence. And again, we've mirroring that now for our care home system as well. And the member engagement toolkit, again, Dudley is the first. I'm not sure others have done the same, but that's been shared. And we've also developed a members dashboard. We've listened to members and we understand that they need more data around their own wards. So that is also being put in place. I'm not sure if it's gone out yet, but it should have done, or it's about to go out. And I think that's it really, but really to say that a lot of what we've done has been in, as a result of the very strong partnerships and collaboration that we have got across the local authority. Thank you, Chair.
Thank you, Val. Do any members wish to ask any questions of Val on this report? Councillor Jackie Cowell and then Kathy Bayton after that. Thank you.
Thanks, Chair. Got 3 points really. I just wondered whether we'd still got priority access for testing for care home staff. I wondered whether the Saltwell Centre was actually still running, or if not, is it possible to get it up and running again fairly quickly if we need to? And the final point was paragraph 43 suggests there's a low uptake in testing in Dudley. And I wondered whether part of the problem with that was the current availability of tests, especially locally, and whether, if we can increase the actual facilities, whether that might help. Thank you.
Kathy, can you ask your questions as well, and Val can do the lot?
Yeah, thanks, Chair, because actually my question does cover testing as well. So I'm aware that, and I've seen the notifications about the 2 new walk-in test centres in Dudley. So obviously that is to be welcomed. I have to say, as people would probably expect, that I am very disappointed that they're being managed and run by Deloitte, rather than it being a local health collaboration between ourselves and possibly CCG and the Trust, who I think would deliver it far better. But really, I suppose I wanted to say, in the report, you've said that we have low testing rates. So there's a whole reason that we may have those low testing rates. We also have some of the lowest infection rates. I guess you could reasonably argue that the more we test, the more infection rates we're going to find. So one would expect that the infection rates will actually start to go up quite significantly when we start to test more. But I also wanted to pick up, I mean, this week I'm aware of a closure of a local primary school for 2 weeks because of the outbreak that they've had there, and it's brilliant that they've reacted really quickly. But I suppose the question is around, is this kind of the first of many, and is this an action that we can prepare for over the coming weeks that we're going to see happen far, far more quickly?
Thank you both. Bal, can you come back on those, please?
Yes, of course. Yes. So yes, the testing in care homes is still taking place, and there is affected by the previous week's challenge with testing, so that's in place. The Saltwell's food bank provision, which was set up in the first wave, was sort of mothballed. We have got plans in place if we needed to step it back up, so we should be able to do that quite quickly if we needed to. And sort of in terms of the low testing, yes, it's a really difficult one, really. I think some of the low testing may just be that initially we had low infection rates, because if you look at our testing rates, they're very similar to the rural areas as well, where whose rates are slightly lower. So our testing rates are still higher than that. There was probably a challenge at one point with the capacity, but that is obviously increased, and we should be able to, our capacity will increase to 900 for the borough, whereas pre-August we only had 300. But we are aware that in certain wards that there is generally a lower uptake, so that's where we are really concerned. And you are right, initially we are likely to see a little bit of an increase, but what we will do is look at the overall trend in terms of rates, and rather than just focus on maybe a week or two. In terms of, I sort of totally understand, Councillor Baton, your sort of frustration with an external provider coming into Dudley to deliver the testing programme. I think we would have been quite happy to have worked a local model up, and indeed that was what we initially did when we first stepped up testing due to the COVID response. We were working with CCG and our local hospital trust to make sure that we had staff trained. So that model is now different, but it comes at no cost to us. But obviously there is a cost somewhere in the system. And then with regards to schools, I have to say Dudley schools have done far better than other areas in terms of managing closures. I know in some areas within the first week several of their schools were closed. What we're doing is we're working with our children's services and schools to learn from each of these outbreaks, so that we're actually going back and thinking about how that could be managed in a different way. Unfortunately, where school closures have tended to occur is down to the workforce and staff. As rates are increasing, you can imagine there's more contacts that are also being contacted and being asked to self-isolate. So where you've got teachers who've been in contact with other teachers, and and I think one of the challenges for us, and I'm sure partners will agree, is that even where we've got COVID secure settings, it's the social mixing of actual workforce that is causing problems. We have agreed today, we've set up a weekly IMT, and we did agree as a partnership across the system that there really needs to be some strong messaging around that. You can be in a school setting, you can be in an NHS setting, you can be in a council setting, and you're adhering to all of the guidance, but when you walk out at lunchtime or in the evening, or or car share, that then going to have an impact on how the virus transmits, and likelihood that further colleagues will need to be isolated and not be able to work. I think I've answered everything there. Chair, is there anything that I might have missed?
No, I think that's it, Val. Thank you. Yeah.
So could I just come back on? Sorry, Chair, I know you want to move on. But just very quickly, Val, other areas have done test and drops. So for communities who are perhaps reluctant to engage, is that a model that is either being currently considered or may well be considered in the future in terms to test and trace some of our more difficult to reach communities?
Yes, through the chair. Yes, Councillor Baton. In fact, I've mobilised 2 of our staff to just go and experience the Birmingham model. I don't really want to, I know things went a bit pear-shaped yesterday with that, but we have, and again, because we've not been on the national watch list, or we're not on the higher tiers, we've struggled to secure some of that additional resource to do things in a different way. We'd put in a proposal to have a pharmacy-led stroke community-led offer in terms of drop and collect, but that was turned down, so I will revisit that again. But definitely we have all of our options open if we can get the resource and agreement from national.
Thank you, Val. Does that conclude the questions from members on this report?
Chair,
Councillor Alan Hopwood. Councillor Hopwood.
It's okay, Chair. It was a mistake. I pressed the wrong button. Sorry about that.
All right. That concludes the voting from the Luxembourg jury then on that. So we'll accept that recommendation. All those in favour? Aye. That's
Aye.
it. Thank
Yes,
you.
Chair.
Now we move on now to our partner reports, and I'm so glad that you've managed to stick with us so far, and I do hope that you've gleaned something from the amount of work that's been going on within the local authority, because I know you're all experts in your own field, but we have a massive amount to do as a local authority in lots of fields. So I hope you found some use in that. The first report is a report of the Black Country and West Birmingham CCG's response to COVID-19. And I think that is Neil Buckton.
Thank you, Chair. I think I should say at the outset that it's not specifically about the CCG. It's really about the local NHS in Dudley, and the report's been put together on the basis of contributions from colleagues, not just in the CCG, but also from Dudley Group NHS Foundation Trust and Black Country Healthcare NHS Foundation Trust, and no doubt they'll wish to comment later. But I'll just make some introductory remarks, if I may. As I've indicated, this has been managed as what we call a Category 4 incident, and it has involved a lot of joint work with our partners, both in the local authority, in adult services, in children's services, in the Office of Public Health, and colleagues dealing with safeguarding issues. So it has been very much about joint working across both local government and the NHS, and with the wider voluntary and community sector. In terms of our incident management capability, then the Black Country and West Birmingham CCG set up an incident centre in Sandwell to coordinate matters from a kind of CCG perspective across the Black Country and West Birmingham system. And then each NHS organisation had its own incident management arrangements in place. We've heard quite a lot about communications earlier from Phil and from Liz Abbis, and the joint work that's gone on in terms of communications. We've obviously been very much involved in that from 2 perspectives, I guess. One, in terms of communication with the health and care system, sort of internal communications in that respect, and then also external communications, messaging to the public and patients about the outbreak and how we're managing it. One of the things that you'll probably be aware that we were very concerned about at the beginning of the sort of COVID period was the ability of the system to respond to the activity that we're expecting. A lot of work went on in terms of trying to analyse potential demand and make sure that capacity matched that demand, particularly in relation to things like ventilation capacity. And on the basis of the arrangements that we put in place across the health and care system, we were able to do that. Obviously, trying to support staff during this period has been very important, and the report describes a lot of the arrangements that were put in place to ensure that the health and well-being of our staff was maintained. You'll see in there particularly what happened at the Group NHS Foundation Trust in terms of their approach to managing staff health and well-being. We also redeployed quite a lot of staff. So from a CCG perspective, we've got a number of nurses who weren't involved in frontline occupations, but were redeployed to the front line. In addition, a lot of administrative staff went to work for organisations like NHS 111. So a lot of our response centred around looking at the skills of the staff that we've had available and redeploying them appropriately. At the last meeting, when we were discussing these issues, we talked a lot about PPE and the work that had gone on in relation to PPE. Again, a lot of joint work there in terms of working with council colleagues and the wider local community. We had a lot of offers around the provision of PPE. From a CCG perspective, we set up a centre in Walsall to supply various parts of the system with PPE, and in particular, we're able to supply council colleagues with PPE during particular times of high demand. One area that has been critically important to us throughout this whole period has been what's been going on in care homes. Bal referred to some of those issues earlier. Again, here, this has been an area where there's been a lot of joint work between the NHS, between adult social care and the independent sector itself. And I think we put a lot of support into our care homes, trying to make sure that they remain safe and have got the right support that they need, particularly in terms of trying to prevent unnecessary admissions from care homes into the hospital, and support for patients who are at the end of life and particularly vulnerable. As you'll know, one of the lessons from this entire period has been around how we have developed new ways of working. Remote working has become the norm, particularly in terms of general practice, but also in terms of provision of things like outpatient services, patients seeing consultants remotely, patients seeing GPs remotely. That's accelerated perhaps at a pace that we didn't envisage before the start of the crisis, and something that we'd certainly be looking to build on for the future. Restoration and recovery has been something that the system's been working on for quite some time now, and I know my colleagues at Dudley Group will be able to talk a lot more about that from their perspective. Whilst we have been aiming to restore and recover services, the big limiting factor there is about being able to maintain safe services and maintain social distance. And now we find ourselves at the point where the system is starting to come under pressure again from what you might call as normal levels of activity. And locally, yesterday, for example, we were under quite significant pressure, and it would appear that not only in the hospital sector but also in general practice as well. So that's something that we're going to have to be mindful of as we move into winter. We've talked a bit in the report as well about specifically about mental health services and the pressure that mental health services have been under. We know now that a lot of mental health issues have been suppressed during this period. And again, in the relatively recent past, mental health services have come under pressure as well. I know a few weeks ago it was very, very difficult to access mental health inpatient beds. That presents difficulties not just for patients who need to be discharged from physical health services and have got a mental health problem, but also in terms of patients who can't be accommodated locally in local mental health services. So again, there are potential pressures in the system that we need to be mindful of. So that's just a sort of few general points to begin with, Chairman. I'll leave it there if I may, and no doubt other colleagues will want to comment as well.
Thank you, Neil. Councillor Elaine Taylor.
Hello. Yes, I'm back with you now properly. I'm at home. Right. Neil, can I ask you, as we're moving into the real bad now areas of the winter, how are we with the flu vaccines capacity? I've seen from my own GP that the volume of serums are very low coming through, and they're taking time to filter through. So are we confident that we're going to have enough vaccines for, you know, everyone? And that comes from, you know, from the top, from the hospitals, and who have their own staff that they have to vaccine, and all of our residents in the borough.
Yeah, as you may be aware, there's been a bit of a national problem in terms of the availability of vaccines. But the message that we've had from general practice is they're gradually working their way, or beginning to work their way through, you know, the cohort of patients that needs to be vaccinated. It's difficult from where I sit at the moment. It's difficult to tell exactly how that's going to turn out, but you know, there are quite intensive efforts going on to make sure that we've got the vaccines available, at least for the most vulnerable groups to begin with. How it goes from there is difficult to say. I know from my own personal experience, for staff within the CCG, whereas we'd normally be vaccinated locally, we're asking staff to be vaccinated in their local sort of community pharmacies, and you know, certainly there are difficulties in accessing vaccines. So yes, there are certainly problems, but we're trying to work through those as best we can.
Thank you, Elaine. Diane Wade, can I bring you in first, please?
Yeah, absolutely. Thank you. I just wanted to add to Neil's report. Thank you, Neil. You gave a very comprehensive explanation of everything that we'd all done during COVID. I just wanted to add to it a little bit, please. First of all, I just wanted to commend the staff that work in the NHS and the care sector for the tremendous response during COVID. I've never seen anything like it. The Dudley spirit absolutely shone through during that period, and continues to shine through, even though we know some of our staff are really struggling and found it very difficult, quite traumatic, and we are providing a lot of wraparound support for those members of staff that are affected. But the majority of staff continue to come to work each and every day, even though they know what they went through the first time with COVID. And as we see the increase in cases, they're clearly becoming quite frightened and worried about what they have to face again. And we talk PPE, but actually wearing PPE, and particularly if you have to wear the FFP3 masks every day for long periods of time for 12 hours, that can be quite traumatic for staff. So, but I also commend our partners across the system. We couldn't have responded in the same way without the support of partners, particularly Matt and his team within the council. Again, the support we had from them was absolutely tremendous, and we did everything that we could to support the care homes as well as much as possible. And again, they put in a tremendous effort. So I think we do have to recognise that. What I'd also like to emphasise is that even during COVID, we did try to keep all of our urgent services going. So we did provide a responsive services to patients with urgent cancer diagnosis and life-threatening conditions, which actually, because we were able to do that, we utilised the private sector. We are in a much better position now in terms of restoration and recovery. We've still got a long way to go, but certainly we are ahead of where we would have expected us to be, really. So the teams in the organisation are working very hard to recover our services, and on 18-week pathways, which are referred to as referral to treatment time, we are the 4th best performing trust in the country around that, and our position around that standard continues to improve all of the time. Cancer, we're doing very well in terms of recovering cancer. What we experienced at the beginning as we began to restore our services, that patients were reluctant to come to the hospital, but I think the message has got out there now that the NHS is open for business, and we are trying to manage everything that's thrown at the organisation in terms of emergency pressures, winter pressures, COVID, etc., as well as beginning to get our services back to the pre-COVID levels. We're not quite there, but we are improving each week in terms of where we need to be. We've got minimal patients waiting over 62 days, and we've got very few patients waiting over 104 days on a cancer pathway. And if they are waiting, it is fundamentally down to patient choice, and we have regular dialogue with those patients on a weekly basis to make sure that they understand the risks, and we try to encourage them to come to the hospital for appropriate treatment. In terms of diagnostics, that's an area of challenge for us, but we are doing very well. An area where it's been more challenging has been around endoscopy procedures. These are aerosol generating procedures, and it's taken us a little bit longer to recover those services, but we undertook some capital work in the hospital, and we've created a 4th endoscopy room, which is allowing us to recover and offer those diagnostic procedures to patients in much larger numbers. So again, that's helped us going forward. We are seeing, as each day, an increase in the number of patients attending the hospital with a COVID diagnosis. So we currently have double the number of patients that we had last week at this time. And I've just had an update from the hospital saying that we are seeing some pressures on our intensive care capacity, but our staff continue to respond. We've got about 100 staff off at the moment with COVID or COVID related symptoms, be it they've got symptoms themselves or their families have, and they're self-isolating, etc. And we provide that ongoing support to them. In terms of flu vaccination, we requested the number of flu vaccines that were required for our staff, and the Department of Health have delivered those in 2 batches. So we received 1,500 vaccines about 10 days ago, and the uptake from staff was tremendous, and we went through those vaccines in 3 days, and we received our final delivery of vaccinations yesterday. And we are prioritising clinical staff in the first instance and then non-clinical staff after that. But the response from the staff around wanting the flu vaccine, again, has been tremendous. And I must say, in previous years in Dudley, it's been really quite difficult getting staff to have the flu vaccination, but this year it has proved much easier. And I'm happy to take any questions that anybody might have.
Thank you, Diane. Just to reiterate what Diane said there, I recently had to go for a gastroscopy, and actually the COVID test on the car park was more traumatic than the gastroscopy, because when you go inside, you feel totally safe. You walk into what is a really professional and safe environment. So I'd urge anyone that needs or gets requested to go to hospital for routine procedures, please take up the procedures. It's safe. And thanks to all of your staff for what you're doing, Diane. All right. So
yeah. Yes, thank you. Thank you for that.
Thank you, Diane. Can I ask Councillor Kathy Baton and then Councillor Jackie Cowell, please?
Thanks, Chair. I've got a couple of questions on care homes, and then another couple of questions relating to Bushy Fields. Do you want me to do them both?
Yeah, if you do yours first, then Kathy.
Okay, thank you. So just wanted to speak a little bit about care homes. Going back to the sort of the peak of the COVID back in April and May time, we heard a lot in the national press about both the discharge of COVID positive patients from hospital into care homes, and also the need for care home residents to have DNRs in place. What was the situation with both of those in Dudley, and what will be the situation going forward in terms of discharge of COVID positive patients? I'd heard some different one of the, I think it was the Methodist care homes, talking yesterday about the risk of discharging COVID positive patients into care homes, and not just around the risk to other residents or to staff, but more about the impact on the other people that you're caring for, in terms of, you know, having to have sort of sterile, secure environments, and how that makes people feel. So it's really checking out what's the Dudley position on both of those. And then Bushy Fields, just wanted to understand how COVID patients were cared for safely and sensitively in Bushy Fields. If there was a positive case, were their needs able to be met within the unit, or did they need transferring into the main hospital? And also, I think there's a mention in the report of regular testing of inpatients in Bushy Fields. Is that a voluntary action?
Thank you. Neil, are you going to answer that one?
If I may, I'll answer the question about care homes. There, I think Marcia Foster's on the call. She can probably want to talk about Bushy Fields. Okay. So, in terms of the discharges to the care homes, we were able to segregate some specific care home capacity for COVID positive patients, and we're looking to continue to do that during this next phase. By being able to do that, we contained the potential problems of outbreaks in our care homes, and we were pretty successful in doing so. So I think that worked very well. Again, that was down to a partnership between CCG, Dudley Group, and our social care colleagues, as well as working in conjunction with the infection control team in Val's department. As far as DNARs are concerned, we had a specific group that was established with colleagues, again, from across the health and care sector, including consultant colleagues from Dudley Group. They looked specifically at what support we needed to put in place for end-of-life care in our care homes, and provided advice on the DNAR process for the care home staff. So, and we've done some subsequent reviews around mortality in our care homes as well. So again, I think that was reasonably successful, and we'd look to continue with that as we progress into the next phase.
Thank you, Neil. Marcia, do you want to come in about Bushy Fields?
Yes, of course, Chair. Can you hear me clearly? Is that okay? Yes. Yeah. Thank you, Councillor Basin. Yeah, just to pick up your questions one by one. First of all, about how COVID positive patients were cared for. I think as at the very beginning of the pandemic, we had this marvellous idea that was actually in line with national guidance, that across the Black Country we were going to designate a single ward for COVID positive patients. I have to say we very quickly realised that was not going to be possible, because quite soon across the whole Black Country, the 4 boroughs, we had more than a whole ward's worth of COVID positive patients. And also we realised, of course, that there is quite a period of time where people might be asymptomatic. So we rethought our plans really, really quickly. And essentially one of the things we did is to just decrease the number of patients that were on our inpatient wards in general. So we spaced people out much more. Fortunately at Bushy, all of the rooms that we have on our inpatient wards are single rooms with mostly with private bathroom facilities. So actually, relative to some of the other configurations of hospital accommodation, it was relatively easy to do that. So we decreased the occupancy of the wards. The commissioners were extremely supportive in that some private sector mental health capacity was commissioned within the Black Country, which really helped us out. There were 2 I think areas where it was particularly challenging, and that was on the older people's wards, where there are a number of people with dementia. And as colleagues might know, there are some people experiencing dementia who have a tendency to want to wander around, and that was incredibly challenging. Fortunately, on our dementia ward at Bushy Fields, there are a relatively small number of bedrooms, and the layout of the ward meant that the staff configured it to try and accommodate people's wandering, obviously with a staff escorting them. So we where possible, we tried to accommodate that, and we didn't try and keep people in their bedrooms. The other area was where occasionally, unfortunately, generally on our adult inpatient wards, where somebody is very, very acutely unwell, and their behaviour is escalating and we haven't been able to de-escalate their behaviour, is that occasionally we have to have a team of people that actually physically hold that individual in a physical restraint, obviously subject to best practice guidance, etc. And that involves getting quite close to the individual. So we were very much cognizant of national best practice. There was lots of guidance being issued for mental health nurses about how to do that safely, obviously using all of the appropriate PPE as well. So it was a challenge, but overall, with the support we had and the measures we took, I think we were confident that we were able to care for people as safely as possible. The other question you asked was about the regular testing. So some weeks into the pandemic, it became a national requirement to test people not only as they were being discharged to care homes, as we've already talked about, but also when they were admitted, and then fairly regularly throughout an inpatient admission. This has been voluntary. I mean, there's always this slight complexity with a mental health inpatient unit that there will be some people that are detained under the Mental Health Act and some people who are there voluntarily. But we haven't forced anybody to have those tests. We've had a very, very high level of compliance with the testing and have dealt with maybe 1 or 2 patients that have preferred not to be tested, and we've accommodated those wishes, but we've carried on obviously trying to encourage people to be tested, and the number of people that have refused outright have been very, very, very small. Does that answer your questions, Councillor Bates? I'm sorry I've rambled on a bit.
Thank you, Margaret. Kathy, you want to come back on that?
No, just to thank you for the clarity and the information, and I'm presuming that the purchase of the private sector mental health beds did make up for the shortfall then that we experienced in our own inpatient wards. Were there any serious shortages in Dudley that led to patients needing to be accommodated outside of the borough?
Well, unfortunately, Councillor, but I'd love to say that we were able to, because prior to COVID, we were making really, really good progress on reducing what in psychiatric and mental health terms we term out of area admissions. Unfortunately, with COVID, we have seen a growth in out of area admissions. But that has primarily been where people require what we know as a psychiatric intensive care facility. So within the Black Country, there is only one psychiatric intensive care ward, which is not in Dudley. It's in another part of the Black Country, and it is a male-only unit. So whenever there are more men requiring that type of very intensive care that we can accommodate in that unit, unfortunately, they have to go outside of the Black Country. And also, if there are any women that require intensive care for psychiatric issues, they automatically have to go outside of the Black Country because we don't have that facility in there. I don't have the figures to hand, but the majority of people that did need that kind of care outside of the Black Country were not from Dudley, they were from the other Black Country boroughs. But Councillor Baton, if you wish to get that, I can certainly provide that more detailed information outside of the meeting if that would be helpful.
Thanks, Marcia. Yes, it would be, but thanks ever so much for your reply. It's really appreciated.
Thanks.
Thank you, Marcia. Just to let you know, I mean, it's already declared anyway on the chair of Dudley Mind, and we've seen a spike in requests for support from our local charity, and that comes at the same time as a massive reduction in income due to sponsorships and fundraising. So it's something that the voluntary sector is going to have to manage over time, I'm afraid. But I'm sure we'll get there eventually. But thanks for your support anyway. Councillor Jackie Cowell.
Thanks, Chair. Something that Neil referred to in his piece, and is also in the report, is reference to these virtual GP appointments. And I just wondered whether on an ongoing basis they would continue to be available, particularly where patients requested them rather than necessarily just arbitrarily set down by the GPs. And on a similar note, I was wondering where we were with dental services, because I know there's been some quite significant problems with getting that back up and running, and I wondered whether we were back to a stage where routine dental work, or even in some cases emergency work, can now take place properly. A further point, at paragraph 58, there's reference to Russell's Hall staff wearing masks in corridors. And I just wonder what the general compliance level was, both in terms of the staff and patients actually accessing the facilities and using those communal areas, what the level of compliance was. And one final point really refers to the Nightingale, but I can't see any better place to raise this. I know that the Birmingham Nightingale, I'm aware of some staff that have actually been made redundant by the NEC, who were originally involved in the construction and, if you like, the wiring up, the sort of electrical side of things, and possibly the sort of mechanical construction. Some of those staff have now been made redundant by the NEC, and I wondered what the position would be if we needed to stand up the Nightingale again, and whether that aspect has been considered. And that's it. Thank you.
Neil.
Yes, thank you, Chair. Yes, as far as video consultation is concerned, gradually now all the practices in Dudley are going to be implementing a new system which is called Footfall, which in effect is a mechanism for triaging patients when they contact their practice, and that will try and provide them with a consultation in the most appropriate way. So that could be a telephone consultation, a video consultation, or a face-to-face consultation. But yes, we certainly anticipate that remote consultation, whether by video or by telephone, will become very much the norm in future. As far as dentistry is concerned, dentistry is starting to move back. The difficulty there is the same as in many respects as what Diane described for endoscopy procedures. Dentistry is aerosol generating, and therefore the ability of the service to continue to accommodate large numbers of patients is limited. But there is some emergency capacity available, and general dental services are starting to come back online as well. I think I'm afraid I haven't got the answer to the question about the Nightingale facility, and I guess Diane will comment on the wearing of masks in the hospital.
Thank you. Diane, did you want to come in on that?
Yeah, I'll come in on that. I can try and answer a little bit about the Nightingale. At the moment, we've been asked to prepare just in case we need to use the Nightingale facilities. So all organisations that are within 1 hour travelling distance of the Nightingale have been asked to nominate a director to work with the team at the Nightingale, just in case we need to use that facility. Obviously, there would be a requirement if we sent any patients there to contribute to the staffing of the Nightingale as well. And obviously, we're all experiencing staffing challenges with people off sick with normal illnesses, but also COVID on top of that, causing some staffing pressures within the organisation. So we are managing that closely, and we are trying to provide a system response to the Nightingale on whether Black Country and West Birmingham could actually use that facility or not, because we're all feeling the very similar pressures around staffing. So that's as much as I can add on the Nightingale. In terms of the question in relation to face masks, we ask everybody who comes into the hospital to wear a surgical face mask. So on entry into the hospital, whether you wear a face covering or not, we ask you to wear a surgical face mask and to gel your hands. And on the whole, compliance is excellent. We don't get very many people causing any problems in relation to that, be it staff, patients or visitors to the hospital. There are obviously patients and members of the public that are exceptions, and obviously they can't tolerate a face mask because of their clinical condition. So we do accept that, but on the whole, compliance has been excellent. In the last 2 weeks, we've also had to implement the wearing of surgical face masks in non-clinical areas. And the reason that we have done that is that we've had 3 outbreaks in the Dudley group, and they've both been in non-clinical areas. And what we have found is we have managed to create what we would consider COVID-free environments for non-clinical staff by having 2 metre separating desks, putting up perspex screens, promoting hands-face space, etc. But what we have found is that staff forget and they go and speak to a colleague and get very close to them. They're okay when they're sat down, they've got the 2 metre space, etc. They've got the screens to protect them, but they get up and they'll just go and ask a colleague a question. And it's in these areas where we've had COVID outbreaks. So we made a conscious decision to ask that everybody who is not in a single person office, our policies that everyone has to, unless exempt, wear a surgical face mask. What we have done, we've been doing spot checks in these non-clinical areas, and I would say that compliance is not as good as we would want it to be. It's only something that we have insisted on in the last 2 weeks, but we are continuing to do those checks in those non-clinical areas. So in clinical areas, I think compliance is absolutely excellent and we don't have any issues. In some of the non-clinical areas, we are constantly reinforcing that and doing spot checks. And I'm just being very open and honest about that, because it is a new way of non-clinical staff working, but compliance each time we go and do those spot checks is getting better, but we're having to constantly reinforce that message.
Thank you, Diane. Does that answer the questions, Jackie?
Yes, thank you.
Yeah, Ta.
Yeah,
Matt Bowsher, you wanted to come in?
Thanks, Chair. Sorry, my connection's been a bit dire this afternoon. So I just wanted to add to the response to Councillor Baton's question about residential care homes. It's been widely reported in the media today that all directors of adult social care have been asked to identify which homes would be able to take COVID positive residents across winter, given the pressures on the NHS. This is going to be a real balancing act for the system here, because I think all of our residential and nursing homes will be a lot warier about accepting any placements of people who are infected. We've got very tight discharge protocols in place with the hospital to make sure people are cleared before they're discharged. But I don't think we're going to have the same capacity available that we did the first time round, and we've worked incredibly hard to keep COVID out of care homes in the borough. So I just wanted to flag for committee's attention that we've got, on the one hand, a duty to maintain flow and continue to support our colleagues in the NHS, and on the other, we've got a duty of care to protect residents in care homes, protect the staff in care homes, and make sure we make those environments as COVID secure as they can be. And that's a tension we're going to have to manage very, very carefully and with really clear and robust public health advice.
Thank you, Matt. Councillor Baton, again, Kathy.
Thanks for that, Matt. That's a really helpful updated position. I'd just request then that this committee is just kept apprised of the developments over the coming weeks and months in relation to this particular issue, because obviously it is an issue that the public feel very, very strongly about. And when anything adverse hits the press, it's not good for any of us. So if we can be just kept apprised of the progress on it, please.
Through you, Chair, I can undertake to do that. And if we need exception reporting in between the meetings, I'm happy to do that too.
Okay. Thank you, Matt. Any more questions about this report from members of the committee? No? Take that as agreed then, so we'll accept that recommendation to accept the report. The next external partner is West Midlands Police. Kim.
Good afternoon, everybody. I hope, can you hear me?
Yes, we can, thank you.
So a big hello to everybody. Obviously, I'm new to the borough. I've replaced Sally Borner, and I'm just coming to the end of week 3. But I must say I've had a really warm welcome from all the partners that I've met over the last few weeks. So it's really good to be here. Obviously, you've got a copy of the report that Jason Anderson wrote, I think, before my arrival. But if you don't mind, I'm just going to give an overview rather than go into the detail of that. And obviously, I'll answer any specific questions if anyone has them. So in essence, there's been a huge partnership approach at all levels in terms of the response to the pandemic, both at that strategic level right the way down to the operational level. And you heard Bal earlier referring to some of those multi-agency operations that have even been running over the last few weekends, which have been really successful, and lots of activity at board level as well throughout the time, and that now continues. From a police perspective, during initial lockdown, I'm sure you're aware, we had far less crime than we would normally across all crime types, but we are now seeing levels back to kind of pre-COVID times. So we are having to balance our resources around the support that's required to the pandemic and also some of our business as usual activities. So the key focus from policing has been in a number of themed locations, and that was really about preventing that holistic spread of COVID, which we know if we prevent it holistically, it does also prevent the spread towards vulnerable people, and really supporting that kind of public health response. So the current themed areas that we are focusing our patrols on, that is mainly PCSO driven, but supported where we need to by our warranted colleagues, are in schools and colleges, transport hubs, open spaces, retail and hospitality. And some of those are where we are seeing spread, so particularly around young people in kind of college school space or in the hospitality sector, but also in locations where we do have some of those powers to be able to kind of enforce where we need to. You'll have heard, and I agree, there's been significant work on joint messaging to encourage compliance with the restrictions to really prevent that spread and protect life, and making sure that all the relevant agencies aren't overwhelmed with cases. And you might have heard before, but the police approach has been along the 4 E's agenda, which is engage with people, explain the reason why we need to be complying with the restrictions and the guidelines, encouraging them to follow, and then finally we would move to an enforcement stage should we need to, and issue fixed penalty notices. In terms of kind of that enforcement level, and something that we've been describing as directions to leave, formal directions to leave since we started recording them at the start of the pandemic across the borough sit at 139. Now that is quite low numbers, and I think it's reflecting of the kind of understanding and the compliance of the community that gets fed back to me pretty much on a daily basis, that there is general good compliance from the majority of our residents and business owners. We have issued in that time 39 fixed penalty notices, and 2 of them were quite recent around some of the businesses that weren't complying with the closure at 10 o'clock, and with a particular focus on eateries there and takeaways that were continuing over last weekend to serve at 10:30 in the evening when they should have been closed. So linked to the kind of the client compliance messaging, there's been a lot of messaging through the Dudley Safe and Sound board, particularly focusing on vulnerability where we knew there were going to be heightened risks during this period. So that's included things like domestic abuse, which we touched on earlier, honour-based violence, modern slavery, lots of work about hate crime, and that's continued this week with Hate Crime Awareness Week, and some grooming and online threats concerns that we've started to kind of see play out. So I gave you some figures earlier around domestic abuse. Just in terms of hate crime, I'll give you some figures there as well. We're actually up 74% compared to where we were last year, which is 135 cases. Again, I do see that as a positive because people are coming forward and telling us about their issues, which gives us an opportunity to intervene. We do regularly see, though, victims not actually wanting to seek a criminal justice outcome in this space, but really they just want that abuse to stop. So we do work with our investigation colleagues and neighbourhood teams and those partners in those third-party reporting centres to get the right outcome for that victim. And then I guess finally, alongside all of that external work, there has obviously been an internal focus from West Midlands Police around ensuring our own COVID security, that we protect our workforce so that we can continue to deliver a policing service. And certainly, touch wood, at the moment, we don't have any major concerns around internal outbreaks or opportunities to deliver the service for Dudley communities from my teams. So I think that's an overarching summary, slightly different to the detail in the paper, but I thought it was kind of helpful to kind of give that, but obviously happy to answer any queries from anybody.
Thanks very much, Kim. Any members wish to ask any questions of the Chief Superintendent? Councillor Jackie Cowell.
Yeah, thanks, Chair, and thanks for that, Kim. One of the problems which seems to be occurring in my ward, and I suspect probably across the borough, is young people, sort of probably school age and just above, really. There seems to be lots of them sort of congregating, and some are wearing hoodies, and they're just causing general ASB, breaking bottles, smashing things up, and just they seem to be hanging around in groups and just causing bedlam. And I just, you know, sort of just generally across the community, particularly in the early evenings and sort of late at night, really. And I just wondered whether that was something that was going on more widely across the borough and what the approach is to that kind of issue. Thank you.
Kathy Bayton, can you ask your question at the same time now, please?
Yeah, thanks, Chair, and thanks, Kim. And it's good to meet you. And welcome on board in Dudley. So statistically, we know that Dudley is one of the safest places to live in the Black Country. And I think you've alluded to some of the definitive increases in certain types of crimes, but it does feel as though there has been a significant increase in violent crime in the borough, and certainly crime in relation to organised drug activity. Is that fair? Is that a genuine rise, or is it that it's become a little bit more focused because of the times that we're all living in? And if it is a genuine rise, what do you feel has precipitated that at this particular time?
Over to you, Kim.
Right, thank you both. So, Jackie, I'll answer your query first. Apologies, I'm not exactly sure which ward you're with because I'm still getting up to speed with that. Chair, are you able to tell me, or do we need Jackie just to?
Stourbridge.
It's Quarrybank and Dudley Wood. That's Quarrybank and Dudley Wood. Quarrybank and Dudley Wood.
Okay, thank you. So, as I sort of talked about in terms of our patrol strategy, we are trying to deal with colleges and schools and those open spaces. So if you haven't or your residents haven't reported those issues, then please do, so we can become aware of them and make sure they are incorporated into our patrols. We have had a number of youths over the last few weeks that seem to be travelling the bus network across the borough after school, early evenings, doing exactly what you have described. So you might have seen some publicity around some dispersal orders that have been put in place by one of the local inspectors, Inspector Sandu, to try and deal with that. And there is a partnership approach looking at that, which is including looking at the opportunity to make the bus passes that the children are using only viable to get to and from school, so they can't continue to travel across the borough and cause those issues. So I think it's probably part of that wider the concern around the group that's travelling. There is a couple of sergeants and the inspector working on that with partners, and I would just encourage any of your residents to report the specifics to us so we can make sure that we're targeting our patrols into those locations where you're seeing those issues. Does that answer the question? Do you want me to move?
That's very helpful. Yes, thank you.
Okay,
if
thank
I
you.
pick up on any more detail, I'll make sure they get through to you.
Absolutely brilliant. And then secondly, the second question around the violence, in terms of the actual data and the figures, year to date, we are not seeing an increase, but I absolutely accept there have been a number of firearms discharges and very serious incidents recently. You are also right in terms of the safety of the borough. I am really impressed in terms of all of the partnership activity towards prevention that I've already uncovered, and conversations with Sue Haywood, the community safety manager, around that. The fact that we are in a really good place, but my commentary is, if we don't keep our prevention activity going, then we are likely to fall in line, with national numbers around kind of violence. So I've recently been talking to my teams. Obviously, I've only been here for 3 weeks, but I've already set out that violence with injury, under 25, gang activity, and prevention of exploitation are our key focuses, and that they're to work around a model where we try and prevent it in the first place. We start to divert if we are seeing issues arise. We take enforcement action where we need to, so we make those arrests where offences are being committed as swiftly and as quickly as we can to get some control measures in around those people. And we make sure we have that rehabilitation approach in place with probation when offenders are released back into the community. So in terms of the figures, there isn't a rise. In terms of some concentrated issues currently, there have been. We are looking into them. We've got an intelligence picture around them. There are likely to be some criminal justice outcomes from those, which will give us some control around some of the people that were committing those offences, and then the work is going to be shaped around preventing that vacuum being filled, which often happens, doesn't it, where we take out some offenders, those ones that are coming up behind kind of try and step into the breach, but that my teams have already been directed around that work, and will be hopefully working in partnership with a number of people on this call around those areas. So again, hopefully that answers it. If you need any more, please do a follow-up question on that one.
Okay, Kathy, did you want to come back on that?
No, thanks ever so much. That's a really useful response and some good reassurances there. Thank you.
Thank you.
Okay,
all right.
thanks.
Thanks very much, Kim. And don't forget, whenever you go anywhere, you must tell people that you're from Dudley, the capital of the Black Country.
Absolutely, I will do.
And welcome to Dudley. And can you please pass on everybody's thanks, really, because our officers put themselves in harm's way when they go into situations, and normally it's going to be with people that aren't taking the right precautions for COVID. So they put themselves in high-risk situations, just like our ambulance staff as well.
Yeah.
So thank them on our behalf, will you, please?
I will do. I will.
Thank you, and thanks for coming today.
Pleasure.
Right, we accept that report, committee. That's an aye then. And moving on to Pippa Wall, the ambulance service report.
Thank you, Chair. I'm hoping you've got the report that's been presented. I know that there's an awful lot of information that has been presented already this afternoon, and I'm also aware of your time. So I was just going to highlight the key points, but again, I'm very happy to take any questions either afterwards or after the meeting or anything that suits. So yeah, I mean, clearly it's been a really busy time for us. We obviously took on the 111 service back in November, which was perhaps fortuitous in that we were able to manage both the 999 and the 111 lines and sort of deploy resources accordingly. When the peak started, of course, at the first peak, I suppose, we were some days taking 4 or 5 times the level of demand in the 111 service, which of course was particularly busy compared to the 999 service during the COVID panic to start with, I guess. So we implemented a lot of measures to to deal with the demand and to make sure that we kept our staff safe as well. So we were dealing with all of the requirements for social distancing, the ever-evolving guidance around infection prevention and control, and that of course meant that we were having to make sure that we were not only following our own guidance on infection prevention and control, but also when we're going into the hospitals that we were meeting their requirements as well. So that we had some complicated processes that we had to make sure the staff were following. So it's certainly been a busy time, but I think the staff did tremendously well throughout all of that, and of course we are now gearing up for that second peak now. Our response really, if we think back to March when this all sort of started, we'd got our full command and control arrangements in place actually following the floods that were in February. Now that feels like a lifetime ago actually, but there wasn't much time from the floods to COVID, you know, so we were already in full swing in terms of our full command and control arrangements. We operate the National Ambulance Coordination Centre, so that was in full swing. We just sort of kept going really and kept the focus on. All of our senior commanders were in. We've got everything working 7 days a week. We took on new staff and redeployed staff like we've never done before, and that involved dual training our 999 and 111 call takers so that they were able to be flexibly deployed to the most appropriate service. We increased our fleet, so we took a number of our non-emergency crews and deployed them as high dependency ambulances. The staff, we have a very valuable team of staff who are employed to prepare the vehicles for the crews as they come on shift. So we increased the size of those teams. We minimised rota abstractions and deferred training and all of those sort of things that we were able to do just to make sure that we had maximum resources available. The other side of increasing our staff was around pulling students back from university, and I'm sure you'll have seen some of that in the media as we were able to deploy students to frontline duties. So we had a structured approach to this. We utilised year 3 students who were very close to completing their studies and deployed them as frontline crew members with a fully trained paramedic. Year 2 and year 1 students were then used to help with the fleet preparation side of things, just to make sure that we were able to cover all of the requirements. Some of our corporate functions, we had staff from our headquarters who were deployed to support the front line as well. Lots of contingency planning. Lots of communication with staff to make sure that everybody was aware of what was going on and that the changing requirements were constantly disseminated. You'll have heard of the PPE issues, and I know that was mentioned earlier on in the meeting. Of course, we have a massive requirement for personal protective equipment. The stocks that were supplied nationally as part of the pandemic response were not really fit for purpose in an ambulance environment, and the stocks that we had that were nationally available for ambulance use were quickly running out early on in the pandemic really. So we, along with a couple of other ambulance services, took it upon ourselves to procure fully compliant equipment separately. We were able to source that, and it was flown into the country, and we were able to sort of make sure that the staff had everything that they needed, and that was a key concern from our staff, as you would imagine, really, that we just had to be sure that we had equipment that the staff could use in any conditions, any weather, that was going to protect them as much as possible. And we have had very positive feedback from staff in terms of the actions that we've taken there. So our working practices have changed. Of course, we've done all of the things that have been mentioned by other organisations as well. The Perspex screens, the taking of temperature on arrival in any building. The cleaning schedules have increased. There's hand sanitizer virtually at every few paces in every building. You know, those sort of things, of course, are standard. Social distancing, of course, is taking place. The trust supplied face masks are mandated in any building rather than fabric face coverings and all of that sort of thing. So we are very, very compliant in all of those things. We've taken the health and well-being of our staff extremely seriously. We're aware of the impact of the pandemic on the mental health and the physical health of our staff. We're also aware, of course, of the heightened risks to some of the staff, particularly the Black and minority ethnic staff, and so we've made sure that we've done full risk assessments with all of the staff who are at high risk. We've supported staff in self-isolating. Those that need to shield, we've got certain areas where shielding staff can work from our trust buildings should they need to. Other staff are able to shield from home. So we've been quite flexible in those arrangements, really, regularly revisiting risk assessments and making sure that everybody's comfortable with the arrangements. And we've had some personal touches, such as the Chief Executive has written to the children of our staff, just thanking them, because of course an awful lot of staff have put in a lot of hours, and a lot of their families won't have seen them, particularly some of the staff who actually weren't able to stay at home during the first wave. So some of those additional touches, I think, have been well received. We also have some additional services that are available in terms of the mental well-being for staff. I won't go into the details. There are a couple of slides within the pack that focus on those services. So please have a look at those if that's an area of interest to you. In terms of testing, then we've been very proactive there. So we very quickly conducted serology testing for all of our staff. That was the antibody testing. So we had in about 3.5 weeks, when the antibody tests were available, we tested over 6,000 staff. We've got a very proactive system in place for testing now, and we are regularly reporting on the numbers of those tests that are carried out. So we've undertaken over 5,000 swab tests and have included family members of staff in those. So we've got about 13% positive tests and 8% positive for family members out of those 5,000 tests that have been carried out. And I'm just trying to think if there's anything else that I need to tell you in terms of testing that I haven't already covered. Those are probably the key messages that I needed to deliver. If there's anything else at all, there is more information in the pack, but I am aware of time and the amount of information that's been presented. So I'll pause for breath, and if anybody's got any questions, then please.
Thank you.
Okay.
Thank you. Kathy Baden, you've got your hand up.
It was a legacy hand, Chair, but thank you. What a comprehensive report. Even I can't find a question on it.
Councillor Jackie.
Yeah, thanks, Chair. Just a brief question. In relation to the staff counselling provision, which is mentioned on page 84, There's some telephone advice and some other access to qualified counsellors, but it does suggest that that's time limited to the end of June and to mid-November. I just wondered, in light of the fact that we seem to be going back into a further peak, and I know this part of this report was probably written earlier, I just wondered whether that sort of thing is still available or will be made available again.
You're muted, Pippa.
Sorry. Yeah, sorry, that is a good point. These were services that were deployed as an additional service for staff. I haven't heard anything in terms of them being extended or re-procured, but we do have a lot of other things that already continue as part of our business as usual. But it's a very good point, actually, Jackie, and I will check on that and just to see if that's something that we are able to extend for staff now that things are continuing. Thank you for that.
Thank you, Pippa. Any more questions from members of the committee? No? Thank you, Pippa. Yeah, it was a fortnight's read, that was. So done in a day. So thank you for that. So, and the same applies to your staff as well, because they also go into situations that they don't know where the danger's coming from. So
they do, absolutely.
Be clear to pass on our thanks to them as well.
Thank you very much. Thanks for your time.
Okay. Report from Health Watch now. Jane Emery. Sorry to keep you, Jane.
Hi. Hi, okay, hi, thank you. And I'm very conscious of time, so I will go through and hoping that everybody has read the paper and the reports that were attached as well. So really just to give a little bit of an update of what Health Watch has been doing during COVID. So obviously members will be aware that predominantly our activities out in the community, we're talking to people, we're capturing experiences and views. So for us, that's been a big challenge. You know, we can't be out there, we haven't been able to hold the events that we ordinarily would have done. So as we're part of Dudley CVS, and I'm not going to steal Andy and Kate's thunder, they provided community support during COVID. So as a Health Watch team, we joined forces and we're there to be able to support with medication collection and shopping collections. This also gave us an opportunity to talk firsthand though to people that were receiving that support and also the volunteers, and we've been capturing their experiences and what that really meant for them. So that was useful for us to be there on the front. We've had to try to look at alternative methods of engagement. How can we link in with people, link in with existing groups? How do we connect with people that we can't go out and see at the moment? How can we increase our presence, social media, so not only Twitter, but also Facebook? So we're trying to see how we can be as creative and innovative, but also be supporting partners with the engagement to see what the impact of COVID has been on people. There's a couple of reports that we've put that we held 2 of our people's networks, that members will be aware that that's ordinarily what we normally hold at Brierley Hill Civic. So we held our first one in partnership with the Clinical Commissioning Group and Integrated Health to talk to people about their experiences of accessing healthcare. We had a number of people attend, interestingly people that ordinarily hadn't attended our events at Brierley Hill Civic, but liked the idea of being on Zoom and that they could be present at a meeting for a couple of hours and didn't have to travel. So that was quite interesting. We made sure it was accessible. We had members of the public that have got a visual impairment and also hearing impairment, and we made sure that we had interpreters. So technology proved its way, and it was daunting at first, but it worked really, really well to make sure that we could engage with those communities. We wanted to ask them what had worked well, what would they like to keep moving forward, and what had some of the challenges been. So I'm not going to all the details of our report, but that report has been shared with partners. It's been shared not only locally, but also on a regional and STP footprint about what people's experiences were. And when we do get to the restoration, the reset, the recovery plans, what actually do we need to try and see if we can maintain? And there were mixed experiences of people. Some people liked what was happening and liked all the digital, and others found that extremely challenging. Our second event that we held, and we held that with in partnership with Matt Boucher and his team from an adult social care perspective, and that was to capture people's experiences that access adult social care and what had been good, what had been some of their challenges. And again, the conclusions and the findings were there. and kind of Matt was really responsive to those and kind of shared those with his colleagues to try to see, recognising some of the challenges that people have moving forward, and how do we need to incorporate those in any future service delivery as we come out of COVID, and recognising that we're in another wave now, but what does this mean for the future? The reports that we did as part of Healthwatch England, we're part of Care Quality Commission, and they've got some reports which is all about Because We All Care. And that campaign is really making sure that people share experiences and their feedback. At times people can be reluctant to do that, but actually it's really, really valid. So we wanted to encourage people to share those experiences. In recognition of these reports and the conversations that we've had with people, and it's not just from us and our perspective, but across partners, exploring digital exclusion or digital inclusion and what opportunities are for people. Lots of people really, really like the fact that everything's technical and it's online, and they're getting to see their GP on the same day and getting their treatment. However, there are lots and lots of people for them that isn't an option, and really are then going to get marginalised. So we've been capturing their experiences about what does that mean for them. And this evidence that we've had an opportunity as part of Healthwatch England to actually put a bid in to see whether we could be successful and get some additional funding for us to be able to start this work. It was announced only today that there's 5 local Healthwatch and there's 148 in the network, and Dudley has been chosen as one of those to do some work with our colleagues within a primary care network to do some targeted work for over 65s, people with disabilities and people that English isn't their first language, to look at what some of those challenges that they've had and experienced. That will just kickstart a greater piece of work that we want to do across the system. So, but for Dudley, that's really, really good. And obviously we're really proud that we're one of 5 across 148 that has been chosen. I don't really want to go into lots more detail. It's just about we're connected as much as we can be, continuing to capture people's experiences, sharing those with partners, looking to see how we can do things differently. We're at the engagement board, we're at the comms board, so we're making sure that we can put messages out as well to people as much as we can. And we're trying to do as much as business as usual, recognising it's very challenging times that we can't be out and engaging with people. That's all I really want to say. Thank you, Chair. Open to any questions.
Thank you, Jane. Anyone wish to ask? Matt Boucher.
Sorry, I don't want to deny the members the right to scrutinise, but I just wanted to put on record thanks to Healthwatch, who've been very, very creative and as Jane said in her covering remarks, very inclusive in the way that they've made sure everybody in the community's had a voice. And I'm delighted they've been acknowledged nationally. They deserve to be. They're a very, very strong Healthwatch we've got locally. The lessons learned from the work we did on the adult social care call have all now been factored into our plans for phase 2, but have also more immediately been fed directly into services that were operating like Access and Pleased to Meet You. So there's a direct link between the feedback the public have given us and the way we're approaching things now. And it's an approach that I fully support and will continue to adopt because there's so many unintended impacts and there's so many misunderstood experiences that people have, and I think we've got a duty to listen and make sure we're responding to the things that the community tell us. So well done, Jane and colleagues, really appreciate the work you've done.
Thank you, Matt. Councillor Jackie Cowell.
Yeah, thanks, Chair. Just one of the things I wanted to follow up was referred to on page 104, and it may not necessarily be Jane, it might possibly be Matt actually that needs to follow up on this one. It references one of the ideas that's obviously come out of one of the events was for the council to have its own signed video service for deaf people to use. And I just wondered whether that had been looked at all, because that does seem like a really interesting idea.
Thank you, Jackie.
Yeah, it does indeed. We've got a number of people who can sign in the visual impairment team. We've got a number of voluntary groups linked to Queen's Cross as well, who also provide that capacity. So we do have that facility. I think as a council, we probably need to think a little bit more about how we use that expertise for things like full council meetings. If this kind of digital form of meeting is going to continue, and it looks like it will do we apply that to community forums? Do we apply it to scrutiny meetings? So the quick answer is yes, the capacity is there. but I think we've got to take decisions about when we make it available, so that we can make meetings more accessible for everyone.
Thank you, Matt. Any more questions on Jane's report? No. Jane, thanks very much, and thanks for all the work you and your colleagues do, and well done on being chosen 5 out of 140 odd. Well done.
Thank you. Thank you.
Thank you. And we'll take that recommendation to accept the report. And eventually, Andy Gray, Community Response, Dudley Council for Voluntary Service, pages 133 to 141. Andy, over to you.
Hi, Dave. It's a quick off camera, a quick on camera, and then I'm going to quick off camera because it's lagging quite badly. So I'm just saying hello. I am really here.
Okay.
Okay. Thank you. In line with everybody else, and I do realise the agenda's obviously struggling a little bit against the time, so I am going to keep it really brief. You've read the report, colleagues have read the report, and we focused on a number of key areas when the pandemic hit, and we've split that in the report into 3 sections, which was our role as a CVS to support the voluntary community and social enterprise sector, so to see how they were coping during the pandemic. We then were looking at facilitating virtual networks for dealing with vulnerability as that emerged over the borough, making sure people didn't fall through the gaps. And then finally, the one that really did explode was the coordinating the emergency response volunteering, which the paragraphs talk about in detail. So those were the 3 things we got stuck into as a CVS and as a voluntary community faith sector. I'm not proposing to go through the paragraphs. They're there. You can all read them. Maybe just move to the recommendations and then just say a few thank yous, really. So I think it is really important that the colleagues on the call, and I know you already have, and many of you have personally, recognise the immense contribution of the sector during the outbreak. I have to say that people stepped forward in their hundreds to support the operation. And they went the extra mile. They were shopping and delivering food and meds for people they didn't know. They were using their own cash to start with. They were genuinely saving people's lives, people who couldn't get out and had got nothing. So we were really proud of the effort, and we're really proud of the philanthropic kind of spirit of people in Dudley. The second recommendation is one that causes me some sleepless nights, which is the future sustainability of the sector that we work for and support, because like everybody else, this has really hit people hard, and Dave, you've already mentioned it. So just for others who aren't that familiar with charities, lots of charities trade, lots of charities have investments, lots of charities sell room hire, they have cups of coffee they sell woodwork stuff they make, they fundraise in all the usual ways. They haven't been able to do that since the end of March. And the sector's been hit big time by loss of income. Our sector does at times feel like the Cinderella service, so money that has been made available nationally hasn't really made its way down to charities, despite the spin. So it feels like a service that, when this really hit, was front and centre to the operation and needed badly. And now, when we're needing some response, we need that response now. It's Dave, myself and you are big on football. It is a bit like the football pyramid, and people lower down the pyramid are really struggling, and some will go out of business, some have gone out of business. So I want some consideration, if I can ask, for future sustainability of the sector we support, and then really just noting the contents of the report. That I'll be quiet and ask for any comments.
Thank you, Andy. Do any councillors wish to ask Andy? Councillor Steve Walther. Steve Walther.
Yeah, sorry about that, Chair. I was rabbiting on there, not realising I was still muted after 3 hours. However, my apologies for joining the meeting much later as well. Like Andy, I don't like these virtual meetings, and I had considerable IT difficulties in logging in today. So there we go. But we are where we are. I have commented at previous meeting, I think, about the actual input and the presence of our treasured voluntary service in Dudley. So I'm really glad that Andy's here today. And I guess virtually, well, firstly, a huge thank you to you, Andy, and your organisation and all in the voluntary sector. Superhuman effort over this COVID period, and I've seen a lot of it kind of on the front line firsthand, I guess. So, you've commented though, and it's a major concern for me as well, because I've heard it a number of times in this last few months, your concerns about the sustainability of the sector. And can I recommend, Chair, that very much Andy said it himself, that we really need a robust conversation here with DCVS and the charitable sector to perhaps reassess the relationship we as a council particularly have with them. And with the new Director of Public Health coming on board, this might be a good time to try and outline and address some of the concerns raised in the report. You mentioned funding, Andy. A question for you. Have you had any direct extra funding allocated directly for the major role that you're expected to play in this pandemic? And if so, did you deem that kind of adequate? I think I know what the answer is going to be. And once again, would recommend that we have a chat about that. Secondly, I notice in the report, paragraph 17 in particular, about the coordination of the national effort with the local effort. And I have to say, I value your insight on this, possibly, because I came across it particularly volunteering at the local hospital with the Russell's Hall volunteers, and particularly the head of volunteering there was absolutely pulling her hair out almost, because we got this national programme of responders that was requested, of which I actually applied for one of those, and I was told via an email I didn't kind of qualify because they couldn't see some of the documentation properly that I'd sent in, and that was the end of it really. But I was actually told by the head of volunteering at Russell's Hall that they were literally crossed swords with them, that they weren't actually coordinating with the local efforts at all, and it was more or less becoming more an obstruction than a help, a hindrance than a help. So I'll be interested to hear your views on the national versus the kind of local effort, if you like. And yeah, and really to review, or perhaps someone could answer that question on our side, the council side, see if we had the similar problems, national versus local links. Okay.
Andy, do you want to come back on that?
Yeah, thank you. Thanks for putting the bullets in the gun there, Steve. So the national volunteering programme, obviously people signed up in their tens of thousands. I can only be absolutely honest about this. So we had very, very little communication with those running the scheme. It felt like we would just get on with what we were doing. We weren't going to hang around and wait. I'm not thinking it's been that well organised, and the communication has been severely lacking. We've seen a report nationally through the CVS network that demonstrates that it has cost circa 80k per local authority area for that scheme to be put into operation. The initial contract breaks down that way, which links me on to the original question. So air response as Dudley CVS, it hasn't been about air money, and the public health were really kind to find 10k, which we asked for volunteer expenses. You know, the volunteers are running around the borough shopping and delivering meds, and occasionally we needed to just go and purchase food for people who were in dire need, and hopefully some of that 10k we will be returning to public health, because people were really frugal. So we weren't asking for anything for ourselves. I think the conversation going forward is we want a longer term relationship with the council and air sector. So I think the funding issue, it wasn't about what money people have had to date. And I know the food bank, don't mind me saying, that they had 10k to help them with purchasing food because they were under extreme pressure. this is more around, the conversation is more around the long-term sustainability of our sector, I think. Although there is a minor frustration that comes from out of our sector because they are aware of additional funds that have come into the local area in significant amounts, and other areas have had grant pots and other ways of commissions for engagement around messaging and other stuff. So I'm trying to answer this as fairly as I can. In terms of, we didn't need a great deal of money to get going to support the voluntary sector. They stepped forward. Volunteers are volunteers. It's a few expenses. I think I'm more interested now in the ongoing relationship and how people can support us as a sector going forward. But I have to say, if some of my colleagues were on here who are not as nice as me, they would be saying, where is all the resource that has come into the area? Because we're really struggling, and they are aware it's in the public domain of the kinds of chunks of money that have been made available. I'll leave it at that.
Okay, I've got Councillor Cathy Baton.
Thanks, Chair. Thanks, Andy, for your presentation. And I would absolutely support Steve's recommendation about the robust conversation going forward to ensure sustainability of the sector, because being quite frank, without that sector, many people within our borough would have been in a far worse position than they were. You know, I did a lot of work with Loaves and Fishes in terms of supporting vulnerable families with food parcels when the voucher scheme hadn't kicked in or was not proving to work for people in our schools. So that sector is absolutely critical. But I just wanted to pick up with Andy, and I picked it up from the combined authority today, that one of the reset asks of government in terms of the voluntary sector is a resilience fund. And I just wondered whether or not you were aware of that ask. If you are, is it worth us putting a recommendation forward today to go forward to the CA, to go forward in turn to government to support that resilience fund? Is that something that would be valuable to you?
I'm not particularly aware of that, Cathy, but there are many things flying around at the moment, and I would absolutely say yes. Obviously, the resilience fund is, if the criteria is the correct criteria, would be absolutely needed and required in Dudley. But I may have missed it. I have repetitive Zoom injury today. It's been back to back all day long, so I may have missed some of that.
No, I do wonder sometimes with the stuff that comes out of the CA how widely known it is, and whether it's just kept within a very small group. So I think we should make the recommendation for Dudley, but also to flag up at a national level that unless the adequate funds are made available for charitable groups to bid into, we will see a massive decline in this sector, and the knock-on impact to our local provision will be hugely affected. So yes, Chair, I'd just like to support those recommendations, please.
Thank you. We'll come back to the recommendations afterwards. Can you write them out so that we can make sure that Steve has got the correct wording, and we can ask all the members present if they agree to the recommendations, please. Matt Boucher, you wanted to come in.
Yeah, thank you, Chair. There are several points I'd like to make here. The first is that the value of the role the CVS undertook and the value of volunteering across the borough can't be underestimated. We very quickly saw the food hub mobilised. We had people from all over the borough, all walks of life, all sort of backgrounds, who played an absolutely integral role in getting people food and medication, but also providing human contact reassurance. There was a hell of a lot of anxiety at the time, and there still is in the community. So there is no price tag that can be put on the impact of that work. Andy and I were on the phone late on many an evening, and the volunteers were going out round the clock to help people who had very limited access to alternative support. So my sincere thanks to them for everything they've done. Secondly, in terms of the funding position, At Cabinet and in the public domain will be a full breakdown of the usage of all the monies that have been received from government by the council in the next couple of weeks. We already know that the expenditure incurred has significantly exceeded all of the money that's come in, some of which has been ring-fenced for specific purposes like the business grants, some of which has been ring-fenced for infection control monies for care homes. So there will be a full and comprehensive breakdown of exactly what's happened with that money available, and Scrutiny will either be able to access it via CMS or we can circulate it to this mailing list. Thirdly, I think it's worth the committee thinking about the recommendations that it makes here, because Andy's quite right to say that, to my knowledge, none of that national funding was ring-fenced for the benefit of the voluntary